Okay, guys, I'm audible. Mic testing 1 2 3. Can we start? 1 2 3. Can we start? Okay, so now let's start our discussion. Okay, so let's start with rheumatology first. So let us see, we have a malar rash, a discoid rash. Photosensitivity means whenever patient is going into sun, this rash will increase. Oral ulcers, synovitis, cardiac involvement, most common will be pericarditis. But in exam, what they ask you a type of endocarditis, and this endocarditis is called as Libman sac endocarditis. Similarly, most common in lung, it will be pleuritis. But in exam, in paper, what they ask you shrinking lung syndrome. Shrinking lung syndrome. So these are some one-liner which they ask in exam. I repeat, most common in SLE you will see. So these are all the MCQs, basically kidney involvement. In kidney, most common manifestation will be DPGN. Then you can see CNS involvement, anemia. In CNS, most common will be decline in cognitive function. Decline in cognitive function. Then patient can develop immunological manifestations. So these are all the features, all the MCQs of systemic lupus erythematosus. So I repeat, what they ask you in exam: most common cardiac manifestation pericarditis, but in exam what's important? One liner, Libman sac endocarditis. Most common lung will be pleuritis. In exam they ask you shrinking lung syndrome. In kidney most common manifestation will be DPGN. Then there will be decrease in cognitive function. There can be anemia and immunological manifestation. What are some new things which they ask on SLE? Understand this thing. There is low activity of C3, and there is some link of X chromosome. This is why this is more in female. Because of this, SLE is more in female. And if you talk about male, it is mainly affecting Klinefelter male. Why Klinefelter male? Because Klinefelter they will have XXY, so they have Y. Done. So they have XXY means they have 2X. Sorry, they have 2X. So this disease is affecting female because of double X chromosome, right? In males you will see X and Y. So there's some pathology have been linked to multiple X chromosome. Lastly, I can say a NICT question which came in exam. It can also be due to mutation activity of TREX gene, TREX gene. So these were some questions or new question on SLE. Then understand, they ask you this cognitive symptoms means और CM होते हैं, that is due to anti ribosomal P antibody. पूरा नाम होता है एंटी राइबोसोमल P एंटीबॉडी और NTP एंटीबॉडी. तो अगर मैं आपसे पूछूं व्हाट इज मोस्ट सेंसिटिव एंटीबॉडी इन SLE, मोस्ट सेंसिटिव और antibody that we use for screening purpose, antibody which we do for screening purpose, this is your ANA. But most specific antibody, this will be your, anyone, any guesses? कोई बताएगा? Any guesses? So most specific antibody will be anti-Smith. अगर anti-Smith, if you see like anti-Smith is not in the option, then choose the answer anti-double stranded DNA, anti-dsDNA. So these are the some MCQ which they ask on SLE. Each and every line जो भी मैंने यहाँ लिखी है, these are important. Okay, now let's see. Sometime like I told you in SLE, arthritis कैसी होगी इसको समझो एक बार. So SLE patient will have arthritis, joint manifestation. So this arthritis will be bilateral, symmetric and non-erosive, means दोनों हाथों में होगी. Symmetrical involvement and non-erosive. Non-erosive means there is no erosion, non-deforming. लेकिन बट अगर पेशेंट को SLE के साथ में rheumatoid arthritis है, so if you see patient is having SLE and along with SLE, patient is having RA. Now this arthritis can be deforming and erosive. आई रिपीट, मैं फिर से बता रहा हूँ, नॉर्मली SLE में अर्थराइटिस कैसी होती है, नॉन इरोजिव, नॉन डिफॉर्मिंग, बट SLE के साथ में अगर रोमेटॉइड अर्थराइटिस है, देन दिस अर्थराइटिस विल बी इरोजिव एंड डिफॉर्मिंग, एंड दिस इज व्हाट वी कॉल, इसको बोलते हैं जकूट्स आर्थ्रोपैथी. वी कॉल दिस एज जकूट्स आर्थ्रोपैथी. सो अभी हम पढ़ रहे हैं लाइक रोमेटोलॉजी का रिवीजन, उसके बाद लाइक विल डू हेमाटोलॉजी, देन वी लेफ्ट विद लाइक नेफ्रोलॉजी, रेस्पिरेटरी, कार्डियो एंड न्यूरो. सो दीज आर द 4 topics which we will continue. Okay, now understand, they ask you APLA syndrome. APLA means antiphospholipid antibody syndrome. So first thing is they ask you APLA syndrome का treatment. So how we treat this? So lifelong you have to give anticoagulation plus antiplatelet. So आपको पेशेंट को लाइफ लॉन्ग क्या देना है, हेपारिन और वारफारिन और साथ में एस्पिरिन, एंटीप्लेटलेट. सो बेसिकली देयर इज रोल ऑफ 3 एंटीबॉडी, एंटी कार्डियोलिपिन, एंटी बीटा 2 माइक्रोग्लोबुलिन एंड लूपस एंटीकोगुलेंट. सो दीज आर 3 एंटीबॉडीज विच यू हैव टू यूज टू मेक अ डायग्नोसिस. तो इसको हम बोलते हैं लैब क्राइटेरिया. दिस इज लैब क्राइटेरिया फॉर, मीन्स वी नीड एनी वन ऑफ दिस एंटीबॉडी. Then patient will have 3 or more miscarriage before 10 weeks, 1 after 10 weeks, and we have to do premature delivery of the fetus because of HELLP syndrome or eclampsia or because of any reason. किसी भी रीज़न से आपको बच्चे की डिलीवरी पहले करनी पड़ रही है because of maternal and fetal well-being. So this is what we call, इसको बोलते हैं obstetrical criteria. We call this obstetrical criteria. So one is lab criteria and second is obstetrical criteria. सो पेशेंट को लैब में इन तीनों में से कोई एक एंटीबॉडी मिलनी चाहिए. देन पेशेंट शुड हैव एनी वन ऑफ दीज फीचर, एंड थर्ड विल बी अ मेडिसिन क्राइटेरिया. एंड व्हाट इज दिस मेडिसिन क्राइटेरिया? अंडरस्टैंड, पेशेंट शुड हैव हिस्ट्री ऑफ आर्टीरियल और वेनस थ्रोम्बोसिस. So this is like your medicine criteria. So this is like a patient जो आप देखोगे patient will be treated by both the department, both medicine and gynecology department. So patient should have any of these, means तीनों में से एक एक symptom चाहिए. You need any one from this list, right? Any one lab, any one gynecological or obstetrical criteria, any one medicine criteria. Means suppose किस तरीके सा क्वेश्चन एग्जाम में आएगा, दे विल गिव यू लाइक अ 30-year-old फीमेल ऑन हर सेकेंड ट्राइमेस्टर ऑफ प्रेगनेंसी इज कमिंग टू यू विथ शॉर्टनेस ऑफ ब्रेथ, सांस फूल रही है. शी हैड प्रीवियस हिस्ट्री ऑफ 3 स्पॉन्टेनियस अबॉर्शन. सो ये आपका क्या आ गया, दिस इज योर गायनेकोलॉजिकल क्राइटेरिया, राइट. दिस पेशेंट इज ऑल्सो हैविंग डीप वेनस थ्रोम्बोसिस इन लेग्स. सो दिस इज योर मेडिसिन क्राइटेरिया. तो अब आपसे क्या पूछेंगे, विच एंटीबॉडी यू विल टेस्ट. तो आप एंटीबॉडी क्या करेंगे, तीनों में से कोई भी एक एंटीबॉडी का टेस्ट कराएंगे, सिंपल. तो दिस इज व्हाट वी कॉल, इसको हम बोलते हैं एंटी फॉस्फोलिपिड एंटीबॉडी सिंड्रोम और अपला सिंड्रोम. सो जनरली एग्जाम में जो मैंने आपको बोला उस टाइप का क्लिनिकल केस आएगा. सो लेट मी से वन मोर वर्जन ऑफ दिस. फॉर एग्जांपल 30-year-old फीमेल इज कमिंग टू यू इन फर्स्ट ट्राइमेस्टर ऑफ प्रेगनेंसी. शी इज हैविंग शॉर्टनेस ऑफ ब्रेथ, डिस्पनिया, देयर इज पास्ट हिस्ट्री ऑफ पल्मोनरी एम्बोलिज्म एंड पेशेंट हैड वन प्रीमेच्योर डिलीवरी बिकॉज ऑफ हेल्प सिंड्रोम. सो अगेन देखो, पल्मोनरी एम्बोलिज्म आ गया, मीन्स मेडिसिन क्राइटेरिया हो गया, राइट. And patients having premature delivery, that will be your obstetrical criteria. Am I clear? Am I clear? So this is about your अपला syndrome. Now कभी कभी, not always, but sometime you will see अपला syndrome patient, they can develop a rash. कभी कभी patient को ऐसी rash मिलती है. This rash in अपला syndrome, ये purple like, we call this purple lace like rash. We call this livedo reticularis. This purple lace like rash is called as livedo reticularis. Okay, now coming to scleroderma. Now just try to understand. In scleroderma we will have a different manifestation. कई सारी manifestation होंगे. So we have a localized form or I can say superficial form जिसको हम बोलते हैं crest syndrome. Crest syndrome, C for calcinosis, R is Raynaud, S is sclerodactyly, E is esophageal dysmotility, S is sclerodactyly, and T is telangiectasia. T will be your telangiectasia. So this is your superficial form. अगर आप देखोगे, if you see the superficial form, Here you will find an antibody. So in CREST syndrome, the antibody is called as anti-centromere antibody. Anti-centromere antibody. But sometime in exam they will ask you systemic form. तो systemic form को हम बोलते हैं systemic sclerosis. So this is first form, CREST syndrome, and second form is called systemic sclerosis. Systemic sclerosis. So understand, in systemic sclerosis you will find antibodies. These antibodies are anti-topoisomerase. Anti-topoisomerase. We also call this anti-SCL70. Now understand this thing, systemic form will have more and more visceral organ involvement. ज़्यादा से ज़्यादा visceral organ involvement होगा इसमें. Now try to understand what is happening. There is action of a chemical called TGF beta. TGF beta is a mediator which will induce fibrosis in your visceral organ. So ये आपके कई सारे visceral organ में fibrosis करेगा. So let's understand this. You can see fibrosis in the kidney. Then patient will have decline in GFR कम हो जाएगा, renin बढ़ जाएगा तो patient को BP होगा. And sometimes this patient will come to you with very high BP. So what we call this, जब BP is very high, so this hypertension can become very high. We call this scleroderma crisis. So understand this thing, in crisis normally in hypertension what we give IV drug, लेकिन इसको आपको treatment कैसे करोगे? We will give oral high dose oral ACE inhibitors. याद रखना इस crisis में steroid नहीं देते. We don't give steroid in this crisis. So understand this thing, what I want to convey here, this TGF beta can cause fibrosis in different organs. So especially it can cause fibrosis in kidney vessels. So then patient will have a high BP. So patient का BP बहुत बढ़ जाएगा. So what we call this? We call this scleroderma crisis. There can be fibrosis in your heart, in your coronary arteries. Then there will be risk of MI or angina. So patient को myocardial infarction के chance बढ़ जाएंगे. Ultimately it can cause heart failure. Patient का ejection fraction कम हो जाए. This can also cause fibrosis in your lungs, in your pulmonary artery. So pulmonary artery में अगर fibrosis होगी so pulmonary artery का pressure बढ़ेगा. It will cause pulmonary artery hypertension. Ultimately this pulmonary artery hypertension, it will cause respiratory failure. And when this will cause respiratory failure, this respiratory failure से patient की death हो जाएगी. So cause of death, they ask you cause of death in scleroderma, it will be respiratory failure, that is due to pulmonary artery hypertension. Done. Now try to understand, there are certain drugs. So ये NEET PG में topic आ रहा है, so they can be asked in your exam also, they can ask you. So drugs like bleomycin याद रखना lung में fibrosis भी कराता है, so indirectly ये भी pH को बढ़ाएगा. Then cocaine, pentazocine is very commonly used in gynecology department. Then many if you see protein supplement जो BCAA आते हैं, जो जिम वाले supplement लेते हैं, तो इसमें tryptophan होता है. So these are the drugs which can cause scleroderma like reaction. So bleomycin, cocaine, pentazocine and tryptophan containing supplement. Okay, let's see. Now you can see this is a reference you can see from standard textbook Harrison. So let's see here. You can see color change पूछते हैं. तो पहले तो हाथ आप देख रहे हो बिल्कुल वाइट हो गया. सो वाइट को मैंने लिख दिया पेल. देन यू कैन सी इट बिकम्स ब्लू. ब्लू मीन्स आई कैन से साइनोसिस हो रही है बिकॉज ऑफ इंक्रीज इन डीऑक्सी हीमोग्लोबिन. अल्टीमेटली इट बिकम रेड. सो दिस इज व्हाट वी कॉल दिस PCR. PCR मीन्स it is color change sequence in Raynaud. Color change sequence in Raynaud. And this color change sequence you can remember like white हो रहा है पहले, फिर blue हो रहा है, उसके बाद red हो रहा है. So it is white, blue, red. So white, blue, red or PCR, this will be color change sequence in Raynaud. Done. So this you can see calcium is precipitating here. So इसको हम बोलते हैं calcinosis cutis. Calcinosis cutis. देन नोटिस हेयर, जो पीछे अगर आप सपोज मैं आपको अगर मेरी उंगली दिखाऊं, सपोज अगर मेरी उंगली देखोगे तो यहाँ पर सबकी उंगलियों में फोल्ड होते हैं. सो ये फोल्ड अगर गायब हो जाते हैं, इफ़ दिस फोल्ड्स आर एब्सेंट, फोल्ड बिल्कुल गायब हो गए, यू कैन सी. इसीलिए शादी से पहले रिंग सेरेमनी होती है ये फोल्ड देखने के लिए. सो दिस फोल्ड्स आर एब्सेंट. व्हेन दिस फोल्ड्स आर एब्सेंट, व्हाट वी कॉल्ड, इसको बोलते हैं स्क्लेरोडेक्टली. सो एब्सेंस ऑफ दिस फोल्ड इन बैक ऑफ फिंगर वी कॉल दिस स्क्लेरोडेक्टली. ओके, नाउ लेट्स टॉक अबाउट जॉगरन सिंड्रोम. जॉगरन सिंड्रोम में पेशेंट को जब जनरली सब कुछ ड्राई होता है, सो जस्ट रिमेंबर पेशेंट विल हैव ड्राइनेस इन डिफरेंट बॉडी पार्ट. सो देर विल बी ड्राई आइज. सो पेशेंट आपको बोलेगा मेरी आंखों में सुबह सुबह सूखापन आता, लाइक ग्रिटी सेंसेशन और सैंड लाइक सेंसेशन. अल्टीमेटली ड्राई आइज की वजह से देर इज चांस ऑफ ब्लाइंडनेस. देर विल बी ड्राई माउथ. सो बिकॉज ऑफ ड्राई माउथ पेशेंट विल टेल यू मेरा मुंह सूखा सूखा होता है. डेंटल स्टेनिंग, दांतों में पीलापन आता है. कभी कभी मुंह से बास आती है, मीन्स हैलिटोसिस. ड्राई आइज, ड्राई माउथ. देन पेशेंट विल टेल यू आई एम हैविंग ड्राई स्किन. ड्राई स्किन मीन्स देर इज एक्सेसिव ड्राई स्किन. तो बार बार खुजली होगी तो आप खुजाओगे. जब आप खुजाओगे तो रैश पड़ेगी. सो ड्राई स्किन कैन कॉज रैश. एंड इफ इट्स अ फीमेल पेशेंट, शी विल टेल यू लाइक आई एम हैविंग ड्राई वजाइना. सो वजाइना इज ड्राई, इट मीन्स नाउ सेक्शुअल इंटरकोर्स विल बिकम एक्सट्रीमली पेनफुल. सो सेक्शुअल इंटरकोर्स काफ़ी पेनफुल होगा. इसको हम बोलते हैं डिस्पारोनिया. वी कॉल दिस डिस्पारोनिया. So patient will have dry eyes, dry skin, dry mouth and dry vagina. Now look at the screen carefully. Patient will have increase in IgA. There is increase in sodium. Salivary phosphate will be reduced. Salivary fluoride will be reduced. Basically it's an autoimmune disease. तो जो antibody यहाँ पर मिलती है, these antibodies what we have is anti-Rho and anti-La. Anti-Rho and anti-La. So these antibody understand. Anti-Rho को हम SSA भी बोलते हैं. Anti-Rho, what we call this SSA, and this anti-La is called as anti-SSB. Now try to understand this. Bilateral parotid enlargement means parotid gland का अगर enlargement हो रहा है, then because of this what you will notice there is lymphocyte infiltration into parotid. parotid में क्या जा रहे हैं, lymphocyte जा रहे हैं. Because lymphocytes they are infiltrating into parotid glands, इसलिए parotid gland सूजो ही लग रही है. Now for dry eyes we do a test. This test is called as Schimmer's test. And ultimately, so this dry eyes के लिए हम टेस्ट करते हैं. We call this dry eyes test or Schimmer's test. Ultimately there is risk of lymphoma. And remember, whenever we have autoimmune disease, so autoimmune disease में कौन सा lymphoma होता है? In autoimmune disease there is a chance of marginal zone lymphoma. There is a chance of marginal zone lymphoma. So right now we have a new drug for this condition, and this new drug is called cevimeline. Cevimeline is approved for xerostomia. Even we can also use this for xerophthalmia as well. So this is cevimeline. Guys, you can ask your doubts in comment box. आप comment box में अपने doubt पूछ सकते हैं, right? Okay, now understand this thing. So let's see. This is, you can notice lymphocyte are infiltrating into parotid. तो parotid gland कैसी हो रही है? You can see bilateral parotid swelling. दोनों तरफ की parotid gland में swelling आ रही है. So we can notice bilateral parotid swelling, right? Then try to understand this thing. You will notice like this is called Schimmer's test. तो आप एक पेपर को ऐड कर दोगे to check the dryness in the eyes. So we call this Schimmer's test. This is Schimmer's test for dryness in the eyes. Okay, moving to next topic called dermatomyositis or polymyositis. Dermatomyositis or polymyositis. So just try to understand this thing. Derma means skin, myo means muscle, itis means inflammation. So derma means skin, myo means muscle, itis means inflammation. Poly means many, myo means muscle, itis means inflammation. So inflammation of many muscle is polymyositis. Inflammation of skin and muscle, dermatomyositis. Now try to understand in dermatomyositis and polymyositis. So जहाँ पर भी skin changes आएगा, the skin changes will be seen only in dermatomyositis. So here you will see inflammation of skin plus muscle, and here you will see inflammation of many muscle. Done. Now try to understand. If you see the patient will have Goutron papules. So these are the papules. You will see where ये papules आपको knuckles पर मिलते हैं. So these are the papular rash which we see in knuckles. Heliotropic rash will be a rash in periorbital area. तो आँख के पास में आपको rash मिलती है. So अब देखो दोनों skin की manifestation है. So periorbital rash will be heliotropic rash. Shawl sign means like female is wearing shawl. Shawl जब हम ओढ़ते हैं, shawl कहाँ होती है? Upper border of breast and back. तो यहाँ पर एक rash होगी. This is called like rash जिसका shape shawl जैसे shawl जाती है वहाँ पर होगा. We call it shawl sign. V sign means a V-neck T-shirt. This is V, suppose this is V-neck T-shirt. तो इस एरिया में अगर रैश होगी वी कॉल दिस वी साइन. नाउ कमिंग टू इफ यू सी रैश इन दिस स्लीव्स एरिया, यहाँ पर अगर रैश मिलती है स्लीव्स पर तो वी कॉल दिस स्लीव साइन. थाई पर रैश होती है देन दैट इज कॉल्ड हॉल्स्टर साइन. So these are all skin manifestation. Then you will find anti-Jo1 antibody. So Jo1 antibody, Jo1 को याद रख लो, Yo1. तो ये Yo1 means युवा औरतों में होती है. It is disease of both these diseases are affecting young female. And very very important, there is a proximal muscle weakness. There is a proximal muscle weakness. Proximal means if you ask me like forearm or arm, it will involve arm. कभी कभी हाथ में कैलस बन जाते हैं. सो इफ़ यू सी लाइक वी पेशेंट विल हैव मैकेनिक्स एंड अ टाइट पाम बिल्कुल टाइट हो जाएगा जैसे कि लेबर और मैकेनिक का होता है. देन इन बायोप्सी यू विल फाइंड पेरिफेसिकुलर एट्रोफी एंड anti-MI2 एंटीबॉडी. दिस इज सीन ओनली इन डर्मेटोमायोसाइटिस. तो अंडरस्टैंड दिस थिंग, द सिमिलरिटी बिटवीन दिस. व्हाट आर द सिमिलरिटीज? तो दोनों में सिमिलरिटी क्या है? So similarity समझो उसको. So both will have certain similarities. So first similarity is in both you will see muscle involvement. Both are affecting young female. Young female means अगर आप देखोगे both are affecting basically 20 to 35 old year female. तो दोनों 20 से 35 साल की फीमेल को अफेक्ट करें. Females are mainly affected. Then you will notice like in both the disease muscle is involved. So muscle टूटेगी. So muscle से क्या निकलेगा? CPK MM. So in both the case CPK MM will increase. So both are having a muscle problem. So in both the case electromyography will be abnormal. In both the case electromyography will be abnormal. And remember in both the case you will see which antibody? Anti-Jo1. So these are the similarities. Just remember anti-MI2 is seen only in dermatomyositis. Now lastly I can say, suppose अगर मैं आपसे पूछूं a 65-year-old female is coming to you with muscle weakness and this muscle is affecting mainly your distal muscles, तब आंसर क्या होगा? So understand this thing, when you see old patient, it can be male or female with some cancer, means with some history of cancer, colon cancer, breast cancer, any cancer, and involvement of distal muscle. अब देखो, अब क्वेश्चन को ध्यान से देखना. Now proximal muscles are not involved. Now it's affecting distal muscle, means अब ये वाले मसल इन्वॉल्व होंगे, डिस्टल वाले, पाम वाले मसल्स और फोर आर्म वाले मसल्स, और आई कैन से फीट मसल्स, सोल मसल्स. ना अंडरस्टैंड दिस थिंग. नाउ दिस इज नॉट अ डर्मेटोमायोसाइटिस. इसको बोलते हैं इंक्लूजन बॉडी मायोसाइटिस. वी कॉल दिस एज inclusion body myositis. Inclusion body myositis. So this is about your dermatomyositis. Okay, moving to ankylosing spondylitis. Ankylosing spondylitis. So this is like a condition which will affect mainly males, because it is in an individual whose height is generally tall, means whose height is above 6 feet. तो जिन लोगों की हाइट जनरली 6 फीट से ज़्यादा की होती है उसमें होता है. So understand this thing. The classical thing you will find here is HLA association. So it is classically associated with HLA B27. So patient will be a tall heighted person. Then you will notice like here the main symptom will be patient will have a back pain or lower backache. This back pain, understand, since it is not an orthopedic back pain, it's a rheumatological back pain. This back pain will be improved. This back pain will improve with activity. So देखो अब सुनो, इसको ध्यान से समझो. पेशेंट बोलेगा सुबह सुबह उठ के पीठ में दर्द होता है, कमर अकड़ जाती है. So this early morning backache with stiffness. But this stiffness will improve with activity or after shower. तो वो बोलेगा नहाने के बाद. तक अब देखो, नहाने में आप अपनी थोड़ी कमर हिलाओगे, डांस करने के बाद, नहाने के बाद, कुछ काम करने के बाद पेशेंट के सिम्टम इंप्रूव हो जा रहे हैं, राइट. So understand this thing. How we make a diagnosis? So here you will see like it is not like rheumatoid arthritis. तो यहाँ पर HLA DR3 DR4 नहीं होगा. Here you will have HLA B27. Then there are some bedside tests which we do in this condition. So first test is called as like there is a diminished chest expansion. Patient अपनी छाती को उतना फुला नहीं पाएगा. Then we can perform Sjögren's test. So to make a diagnosis you will do MRI. आपको एक spine का MRI कराना पड़ेगा. And in treatment what we give NSAIDs for local pain relief. then we can start MTX. MTX is methotrexate. और जब भी methotrexate चालू करते we'll always give folic acid supplementation. So this is about your ankylosing spondylitis. Okay, moving to next condition, we call it psoriatic arthritis. तो पहले इसको जरा समझो, just try to understand this thing. Suppose if in any arthritis rheumatoid factor is positive, rheumatoid factor positive नहीं है तो anti-CCP positive है. तो इन दोनों में से कुछ भी पॉजिटिव अगर हो, if rheumatoid factor or anti-CCP, CCP means anti-cyclic citrullinate peptide, if this is positive, then this type of arthritis is called seropositive arthritis. If rheumatoid factor or anti-CCP is negative, rheumatoid factor or anti-CCP is negative, then what we call this? इसको बोलते हैं seronegative arthritis. So we have seropositive, seronegative. So understand this thing. The classical example of seropositive arthritis will be RA. RA means rheumatoid arthritis. So seropositive arthritis का example क्या होगा? RA. In seronegative arthritis, understand we have JRA. JRA meaning is juvenile rheumatoid arthritis, ankylosing spondylitis, IBD associated arthritis. IBD associated arthritis. IBD means inflammatory bowel disease. Then we have psoriatic arthritis. Psoriatic arthritis. This is a rare type. बहुत rare type होती है. We call this undifferentiated arthritis. Undifferentiated. And last one will be reactive arthritis. So these you can remember with the mnemonic. That mnemonic is Jaipur. So seronegative arthritis you can remember with the mnemonic Jaipur. तो मेरी बात समझो, like you can see psoriatic arthritis is also an example of seronegative arthritis. So psoriatic arthritis means patient will have a current history of psoriasis. Current history नहीं है तो family history होगी. Family में किसी को psoriasis है. Family history नहीं है तो past history. So just try to understand this thing. मेरी बात को समझो. Patient is having, या तो अभी मरीज को सोरियासिस है और ख़ानदान में किसी को, लाइक भाई बहन में, मम्मी पापा में किसी को सोरियासिस है या पहले सोरियासिस थी, then you will see nail dystrophy, nail changes like pitting of nail, onycholysis, onychorexis, right? Oil drop sign. Rheumatoid factor is negative. Then currently what patient is having? He is having dactylitis. Dactylitis means inflammation of digits, inflammation of fingers. And you can see new bone formation. So ये 5 feature जो मैंने आपके सामने रखे, these 5 symptoms which I have written in front of you, these 5 symptoms, what we call them? We call them Casper criteria. So Casper criteria is used to diagnose psoriatic arthritis. Casper criteria is used to diagnose psoriatic arthritis. So for treatment, understand this again. For symptomatic pain, we will give NSAIDs. और पेशेंट को अगर आपको ठीक करना है, सो वी विल यूज़ methotrexate. एंड आई टोल्ड यू methotrexate के साथ हमेशा क्या ऐड करते हैं? वी विल ऑलवेज ऐड फॉलिक एसिड सप्लीमेंटेशन, राइट? सो जस्ट रिमेंबर, सोरियासिस, फॉर सोरियासिस वी यूज़ पोवा थेरेपी, बट सोरियाटिक अर्थराइटिस के लिए क्या देना है आपको? सोरियाटिक अर्थराइटिस व्हाट वी गिव methotrexate. So this is your you can see dactylitis. Dactylitis means inflammation of fingers. So fingers become swollen, उंगलियां सूज जाती हैं. So these fingers, sometimes what we call them sausage digits. ऐसे उंगलियों को क्या बोलते हैं? We call them as sausage digits. Done. So this is Casper criteria which we have discussed. Again a reference from Harrison. Casper criteria is used to diagnose psoriatic arthritis. Done. सेम चीज़ को हमने थोड़ा शॉर्ट में लिख दिया. Now coming to IBD. So just remember, इसको हम GIT में पढ़ेंगे. Just remember this is IBD. IBD means we have Crohn's disease and we have ulcerative colitis. So दोनों में आगे जाके both these condition later on they can convert into there is chance of arthritis. So both will increase the risk of arthritis. So these are basically, I can say, extra intestinal manifestation of Crohn's disease and ulcerative colitis will be arthritis. Done. Okay, now coming to reactive arthritis. In reactive arthritis, what you have to remember. So, अब इसको समझो, यहाँ पर क्वेश्चन कैसे आएगा, हाउ what type of question they'll ask you in exam. They will give you like patient is having a past history of, so there is a past history of some UTI. So patient को कुछ टाइम पहले UTI हुआ, और patient can have past history of respiratory tract infection RTI, और past history like इंडिया में gastroenteritis काफ़ी कॉमन है, तो past history of gastroenteritis. So past history of UTI, respiratory tract infection or gastroenteritis. Sometimes they will not give you these words, they will give you name of the common microbe, or they can also mention past history of some STD. Means suppose few weeks before patient had, suppose I can say ureoplasma infection, or they can use like a mycoplasma infection. तो पेशेंट को 2 हफ्ते पहले सपोज माइकोप्लाज्मा का निमोनिया हुआ था, और they can give you like patient is having gastroenteritis. means इंडिया में छोले भटूरे, छोले कुलचे, स्ट्रीट फूड काफ़ी कॉमन, so patient have salmonella infection, or I can say shigella infection, और पेशेंट को क्लमाइडिया हो गया, एसटीडी हो गया, या निशीरिया का इन्फेक्शन हो गया. so these are some common microbes. They can also sometimes use Yersinia. So try to understand patient is having past history of some infection. Then few weeks later understand patient developed urethritis. कुछ हफ्ते बाद क्या हुआ, यूरिथ्राइटिस हो गया. देयर इज कंजंक्टिवाइटिस and there is arthritis. So understand this thing. So we can remember this with a mnemonic: can't see conjunctivitis, can't pee urethritis, can't dance with me arthritis. So can't see, can't pee, can't dance with me. This is a triad that we see in reactive arthritis. This reactive arthritis, understand, we also call this, इसका दूसरा नाम क्या होता है, we also call this Reiter syndrome. Reactive arthritis is also called as Reiter syndrome. So this is about the reactive arthritis or Reiter syndrome, which you have to remember. Now coming to the important topic called gout. So gout means it is a state where uric acid is increased in your joints. देखो, जब यूरिक एसिड जॉइंट में बढ़ रहा है तो ज़रूरी नहीं है कि ब्लड में बढ़ा हुआ मिले. सो इन ब्लड इट कैन ऑल्सो बी नॉर्मल. सो इन एडवांस फॉर्म यू विल सी, एडवांस केसेस में यू विल सी फॉर्मेशन ऑफ टोफाई. मेल्स को ज़्यादा होता है, एंड जनरली द अटैक्स आर ट्रिगर्ड बाय अल्कोहल. एंड रिमेंबर, सीरम यूरिक एसिड may be normal because uric acid they are concentrating, they are going where into your joint. So we have acute gout, we have chronic gout. Now understand this thing. जब आप एक्सरे कराओगे gout के पेशेंट का, then in this X-ray you will notice this overhanging edges with sclerotic margin. So you will notice this overhanging edges with sclerotic margin. इसको हम बोलते हैं Martel sign. This is what we call this Martel sign. It is overhanging edges with sclerotic margin. And understand, in biopsy you will see these needle shaped crystals. In biopsy you will see these needle shaped crystals, and these needle shaped crystals, remember, these are negative birefringous crystals. Then understand, there is a metal which can precipitate gout. This is called lead. So कभी कभी lead से भी patient को gout हो जाती है. So gout due to lead exposure is what we call this Saturnian gout. देखो, ये रैपिड रिविजन है तो यहाँ पर सारे क्वेश्चन की ही मैं बातें कर रहा हूँ, बिकॉज these are the question which they ask in exam. Okay, now coming to management part. So in acute gout, our goal as a physician will be to make the patient pain free. आपको पेशेंट का दर्द कम करना है. तो दर्द कम करने के लिए, for decreasing the pain, what we have to give NSAID. Second thing is, if it is not controlled by NSAIDs, then we can think of starting steroid. तब आप पेशेंट को steroid चला दो थोड़े टाइम के लिए. And if it is not controlled, with this also we can use colchicine. So these are the drugs we have in acute gout. In chronic gout we have two options. या तो uric acid का production बनने मत दो. So stop the production of uric acid. So for this what we need to inhibit the enzyme called xanthine oxidase. So what we give xanthine oxidase inhibitors like allopurinol, and a new drug that is called febuxostat. New one से मेरा मतलब है, this is new xanthine oxidase inhibitor compared to allopurinol. Second option will be, we can give something which will take uric acid and this will be removed, it will be kicked out of the body through urine. ऐसे ड्रग्स को बोलते हैं uric means uric acid को सू means सू में निकाल देता है, uric. And then what we have new drugs. So understand this, these two drugs are xanthine oxidase inhibitor, means they will inhibit production of xanthic oxide, they will inhibit the production of uric acid production को बनने से कम करेंगे. xanthic oxide को inhibit कर दोगे तो uric acid बनेगा नहीं. Uricosuric like we have probenecid, sulfenparazone. Then what we have some new drugs. So what are the new drugs? These are basically drugs which are product of recombinant DNA technology. We also call them recombinant uricase, like rasburicase, pegloticase, So these are what? These are newer drugs which we have for gout. Now understand, just remember this rasburicase, pegloticase, these are expensive drugs, थोड़े महंगे भी आते हैं, so we will not use them in routine gout. So इनका use कब करते हैं? So they are used in two scenarios. First is refractory gout. Refractory gout means आपने सब कुछ try कर लिया, उसके बाद भी ठीक नहीं हो रहा. In refractory gout we use the second possibility we use them where? In tumor lysis syndrome. इसको कहाँ यूज़ करते हैं? इन ट्यूमर लाइसिस सिंड्रोम. सो दिस इज़ अबाउट योर गाउट. यू कैन सी दीज आर द टोफाई. सो टोफाई बॉडी में कहीं भी बन सकते हैं. सो दिस इज लाइक एडवांस फॉर्म ऑफ गाउट एंड दिस एडवांस फॉर्म ऑफ गाउट इज कॉल्ड एज टोफेशियस गाउट. So mainly you will see them where in olecranon, but you can see this anywhere. Tophi. These are the needle-shaped crystals which are like negative birefringence. And basically these crystals, कभी कभी पूछते हैं crystals बनते किससे? So these are made up of MSU. These are monosodium urate crystals. Okay, so you can compare here this gout with pseudogout. So understand this thing. If you compare this gout with pseudogout, so in gout you will see these crystals are made up of monosodium urate. In pseudogout these are made up of CPP. CPP means calcium pyrophosphate. Then if you see the shape of crystal, these are needle shaped crystals. And in pseudogout the shape of crystals will be rhomboid crystals. Finally, the last difference which I will say, these crystals are negative birefringence and these crystals are positive birefringence. So this is about your gout and pseudogout. एक और आपसे पूछते हैं like in gout most common joint. So remember in gout, so these are all about gout, this is all about pseudogout. In gout most common joint will be first MTP. In pseudogout most common joint, this will be knee joint. So this is something which you have to remember about gout and pseudogout. Done. Okay, now understand Charcot joint. So what is Charcot joint? Charcot joint means देखो कभी कभी joint में destruction होगा but pain नहीं हो रहा है. So we call this painless destruction of joint or neuropathic joint disease. Means in rheumatoid arthritis you will see destruction. वहाँ पर भी आपको destruction होगा लेकिन वहाँ पर pain भी होता है. तो Charcot joint, understand, we also call this as chiroarthropathy. We also call this as chiroarthropathy or neuropathic joint disease, or you can call this painless destruction of joint. So what are the example of disease? So here you will see this there in diabetes, tabes dorsalis, amyloidosis, leprosy, syringomyelia. So अगर मैं आपसे पूछूँ most common cause of Charcot joint or chiroarthropathy, it will be diabetes. Now try to understand. एक पेपर में फोटो पूछते हैं एग्जाम में बार बार. दिस इज लाइक व्हेन देयर इज पेनलेस डिस्ट्रक्शन देन पेशेंट कैन नॉट डू दिस. इसको बोलते हैं प्रेयर साइन और नमस्कार साइन. सो वी कॉल दिस एज प्रेयर साइन और नमस्कार साइन. प्रेयर साइन और नमस्कार साइन मीन्स पेशेंट कैन नॉट डू दिस नमस्कार. सो वी कॉल दिस Charcot joint chiroarthropathy. Then chromosome 15 tall height, fibrillin mutation, autosomal dominant in nature. Pectus carinatum means pigeon जैसा chest होगा. You will see like a deformity in that chest. Ectopia lentis means lens will be having dislocation. Mitral valve prolapse, it can cause mitral regurgitation. And there is dilatation of ascending aorta which will cause aortic dissection. And aortic dissection is the cause of death. So these are all the MCQs on Marfan syndrome. So these are all the MCQs on Marfan syndrome. Done. So these are all the MCQs which you have to remember on Marfan syndrome. Moving to osteoarthritis, understand in osteoarthritis you will see Behçet node and Heberden node. So understand this Behçet node, these are seen where? In PIP joint, and Heberden nodes, these are seen in DIP joint. So osteoarthritis will have this node formation. कभी कभी ये nodes थोड़े से they look like tophi which we have studied in gout, but tophi थोड़े बड़े होते हैं और कहीं भी हो सकते हैं. These nodes are smaller and located only in PIP and DIP. Moving to osteoporosis, so we have again ये topic आपने ऑर्थो में पढ़ा ही होगा, so just try to understand. If this we calculate this with the help of T score, so it is -1 or more, it's normal, -1 to -2.5 osteopenia. So when we call this osteoporosis, when this value is less than 2.5. So कई सारे ऑप्शन है आपके पास, like we can use calcium supplement, we can use vitamin D, we can use like HRT. HRT means hormone replacement therapy. We can use calcitonin. Calcitonin कैल्शियम को वापस से बोन में भेजेगा जिससे बोन स्ट्रांग हो जाएंगी. So understand this thing. These are the option to treat osteoporosis, but remember the drug of choice will be bisphosphonates. And now what we have a new drug that is called a rank ligand inhibitor. A rank ligand inhibitor which we have for osteoporosis. This rank ligand inhibitor is called denosumab. Rank ligand inhibitor will be denosumab. This is for osteoporosis. Now coming to RA. RA means rheumatoid arthritis. So they ask you different type of question in exam from RA. So we have a diagnostic criteria called ACR-Euler criteria. इसको समझो. ACR-Euler means American Colleagues of Rheumatology, and Euler means European League Against Rheumatism. So this is a diagnostic criteria. So in RA, this is a disease which will affect females. HLA which you have to remember here will be HLA DR3, DR4. HLA DR3 होगा, DR4 होगा. Then in rheumatoid, I understand patient will have arthritis, so mainly this will affect your smaller joint. So it is like a bilateral but deforming arthritis. Bilateral deforming arthritis, and you can see deformities. Deformities like you can see swan neck deformity, and swan neck को अगर उल्टा कर दो then you will get a botonier deformity. So just understand this. Swan neck means, this is called swan neck means you can see flexion of DIP and hyperextension of PIP. अगर मैं इसको ऐसे बताऊँ, this is botonier. So this is botonier. Botonier means you can see flexion किसका हो रहा है? Now you can see flexion where? Now you can see flexion of PIP and hyperextension of DIP. So this is botonier and this is swan neck. तो जब मैं अपने लेफ्ट हैंड से कर रहा हूँ, this is swan neck and this is botonier. So these are the deformity. Then you can see joint number. So ACR-Euler criteria में क्या होगा? Joint number, serology, acute phase reactant and duration. So these are 4 feature. जितने ज़्यादा छोटे joint involve होंगे उतने RA के चांस होते हैं. Now what else they ask you? They ask you question like what is cause of death? So RA will have many extra articular manifestation. What is most common extra articular manifestation? So understand this thing, most common joint के अलावा you can see skin में nodule बन जाते हैं. So these nodules are called as rheumatoid nodule. These nodules are called as rheumatoid nodules, and cause of death will be heart failure, or I can say patient को ischemic heart disease और MI हो जाएगा, means cardiovascular disease will be the cause of death. So आजकल हमारे पास एक नया ड्रग है, this is a new drug. So this is like ACR-Euler score. अगर पूरी composite score value is coming 6 or more, then we call this could be RA. So tofactinib is the new drug. This is a JAK1, JAK3 inhibitor. JAK1, JAK3 inhibitor, tofactinib. Most common anemia is normocytic, normochromic anemia, and most common cause of death will be heart involvement or heart diseases. This is the topic question which they ask from RA. देखो पहले हम चालू करते थे steroid से, but now straight away we start treating the patient with DMARDs. So you can see morning stiffness. This morning stiffness generally will be lasting for more than 45 minutes. So patient बोलेगी सुबह सुबह मैं हाथ पैरों में अकड़न आ जाती है तो मैं अपने पति के लिए खाना नहीं बना पाती. आजकल की फीमेल होगी तो बोलेगी सुबह सुबह मैं जोमेटो से और स्विगी से ऑर्डर नहीं कर पाती, बिकॉज स्विगी से ऑर्डर करने के लिए भी उंगलियां चलानी पड़ती हैं, राइट. सो सिमेट्रिकल अर्थराइटिस, rheumatoid nodule, you will see one of the most common extra articular manifestation. Then rheumatoid factor, this is positive in 70% of patient. 70% patient में rheumatoid factor positive होगा, but anti-CCP it is positive in 98% of patient. So you can see joint erosion with narrowing of joint space, normocytic normochromic anemia. Then we have Felty syndrome. What is Felty syndrome? Anyone? कोई बताएगा Felty syndrome क्या होता है? Rheumatoid arthritis along with Kohl-Werker pneumoconiosis, इसको बोलते हैं Felty syndrome. And now we start treatment with methotrexate and the starting dose is 7.5 to 15 mg once in a week. Methotrexate को हफ्ते में एक बार देते हैं, डेली नहीं देते, because it's a very toxic drug. Moving to next, sarcoidosis. So sarcoidosis, it is something which is a diagnosis of exclusion. इसका diagnosis आप सबसे बाद में बनाते हो, once you rule out every other thing. आप पहले सब कुछ रूल आउट करोगे, then you make a diagnosis. So sarcoidosis is a disease which is commonly seen in female, and generally it is more seen in black female or African female. So most common organ will be lung, followed by lymph node. Then you can find some bodies. So what are these bodies in sarcoidosis? You can find Shaman bodies. You can find asteroid body, Shaman body, asteroid body. Then you can find residual bodies. ये दोनों आपको याद रखने, Shaman और asteroid. There will be non-cacheating granuloma. Skin will be having rash. अब देखो ये स्किन रैश बिल्कुल SLE के जैसे दिखती है. We call this lupus pernio with two differences. First difference will be, देखो first time this rash will look like SLE. अब आपको कैसे डिफ्रेंशिएट करोगे दिस स्किन रैश? अगर ये फोटो एग्जाम में आ गया, हाउ यू विल डिफ्रेंशिएट? फर्स्ट इज दिस टाइप ऑफ रैश इज मोर डीप, एंड सेकंड दिस टाइप ऑफ रैश दिस विल इन्वॉल्व नेजोलेबियल फोल्ड. ये जो फोल्ड है SLE ये फोल्ड को इन्वॉल्व नहीं करती, दिस विल इन्वॉल्व. सो पेशेंट विल हैव फीवर, पैरोटिड एनलार्जमेंट एंड यूवियाइटिस, फेशियल नर्व पाल्सी. तो व्हाट वी कॉल दिस, इसको क्या बोलते हैं? वी कॉल दिस एज हीरफॉर्ड सिंड्रोम. So sometime you will see sarcoidosis patient will have two syndrome, Hereford syndrome, and अगर patient को fever है, erythema nodosum है, hilar lymphadenopathy है, we call this Sjögren syndrome. So these are two syndrome which you have to remember in sarcoidosis. Hereford, Sjögren. There is increase in activity of ACE. Gallium scan अगर आप कराओगे, we call this gallium 67 scan. So in gallium scan you will find panda sign. In gallium scan you will find panda sign. Then we can do Queen test, then we can do BAL. BAL means bronchoalveolar lavage. So in BAL you will find CD4 is to CD8 ratio. You will find CD4 is to CD8 ratio, and this ratio value you will see it is increased. देखो HIV में ये रेशियो कम होता है, यहाँ पर बढ़ रहा है. Then we can have like scoring system based on X-ray. Scoring system का नाम होता है स्कैडिंग स्कोरिंग सिस्टम. And you can see like involvement of lymph node in the X-ray, इसको बोलते हैं Garland sign. Garland sign means you will also see like there is right hilar lymph node involvement, left hilar lymph node involvement. So right और left दोनों तरफ की hilar, और एक you can notice there is one more, I can say right paratracheal lymph node involvement. So ये तीन lymph node involve हो गए. You will see these three lymph node involvement. We call this right hilar, left hilar and right paratracheal. तो दिस इज़ व्हाट वी कॉल, तो जस्ट मैं लिख दे रहा हूँ यहाँ पर, इट इज़ राइट हाइलर, लेफ्ट हाइलर, लेफ्ट पैराट्रेकियल. पूरा इंपॉर्टेंट नहीं, जस्ट दिस थ्री, राइट हाइलर, लेफ्ट हाइलर, राइट पैराट्रेकियल. तो दिस इज व्हाट वी कॉल दिस 1 2 3 साइन. सो गार्लैंड साइन का दूसरा नाम होता है 1 2 3 साइन. डन. एंड ट्रीटमेंट, इन ट्रीटमेंट व्हाट वी गिव, इन ट्रीटमेंट वी विल गिव स्टेरॉइड्स. In treatment we will give steroid. Okay, so this you can see cacheating granuloma, then you can see non-cacheating granulomas. These both granulomas you will see where in a patient of sarcoidosis. So this is your you can notice right, this is one, this first one is, this one is right paratracheal, this is right hilar, this is left hilar. This is called Garland sign or 1 2 3 sign. This is a rash which we call lupus pernio. अब देखो यहाँ पे ये जो फोल्ड दिख रहे हैं नाक वाले फोल्ड, ये फोल्ड, these folds are actually not involved in SLE, बट यहाँ पे ये फोल्ड इन्वॉल्व होंगे. तो दिस इज व्हाट वी कॉल, इसको हम क्या बोलते हैं, वी कॉल दिस लूपस पर्नियो. This is called lupus pernio. Okay, now moving to vasculitis. So for vasculitis we have a classification. This classification is called as Chapel Hill classification. So based on this we can classify vasculitis into large vessel vasculitis, medium vessel vasculitis and small vessel vasculitis. So यहाँ large का मतलब एकदम large नहीं, means we are doing a comparison. Large means बाकी दो के हिसाब से बड़ी. So understand this thing. So large vessel you can remember by mnemonic. This mnemonic will be 2T. 2T means temporal arthritis and Takayasu's arthritis. Temporal Takayasu. Medium you can remember by mnemonic. This mnemonic will be Pandit means Pan. Kawasaki bike. We call this Pandit Kawasaki bike. So medium you can remember by mnemonic Pandit Kawasaki bike. Pandit Kawasaki bike means, Pandit means first three letter Pan. Kawasaki is Kawasaki disease. And with bike you can remember Behçet disease. Behçet disease. So Pandit's Kawasaki bike. Now coming to स्ट्रेस बहुत हो गया है, क्वेश्चन नहीं बन रहा है. स्ट्रेस को मतलब यार स्ट्रेस किस बात के लिए नहीं, तुम्हारे छोटे छोटे स्ट्रेस है, चिल रहो, रिलैक्स रहो. क्वेश्चन बनेंगे, नोट्स को ठीक से पढ़ नहीं रहे हो इसका मतलब. यस, पान खाता बच्चा याद रख लो या पंडित कावासाकी बाइक, जैसे याद हो जाए वैसे याद रख लो ना. बाकी सारे किस में आएंगे, स्मॉल वेसल. लाइक व्हाट वी हैव चुर्ग-स्ट्रॉस syndrome, then we have Wegener's granulomatosis, Hanoch-Schönlein purpura, and the one which we have, this is something previously इसको हम पान का वेरिएंट करते थे. नाउ इट इज अ सेपरेट डिजीज, वी कॉल दिस माइक्रोस्कोपिक पॉलिएंजाइटिस. राइट, देखो डरते नहीं है, क्वेश्चन नहीं लग रहा है इसका मतलब कहीं ना कहीं नोट्स पढ़ने में प्रॉब्लम हो रही है. तो उस नोट्स को दोबारा से पढ़ो. राइट, टॉपिक वाइज जाओ, इस बार टॉपिक वाइज जाओ. मैं सपोज आज रोमेटोलॉजी पढ़ ली तो उसके क्वेश्चन लगाओ. Okay, now come to temporal arthritis. Now say they ask you, this is like a superficial temporal artery which is most common artery. The most common symptom which patient will have is headache. Most dangerous symptom or most dangerous complication, this is blindness. तो most common, most dangerous. अगर मैं आपसे पूछूं most common artery involved, this will be your superficial temporal artery. And how we make a diagnosis, आपको आर्टरी की बायोप्सी करेंगे. तो वी नीड टू टेक, नाउ सी इन्फ्लेमेशन यहाँ पर सेगमेंटल होती है, स्किपिंग होती है. तो वी नीड टू डू आर्टरी बायोप्सी लाइक अ लॉन्ग सैम्पल बायोप्सी. तो आपको व्हाट यू हैव टू डू, वी हैव टू डू अ लॉन्ग सेगमेंट बायोप्सी. And in treatment we give steroid, and generally the dose of steroid that we use here will be 1 mg per kg. Done. Okay, now coming to many cases, close to 23 to 35% पेशेंट, इनको पूरी मसल्स में, बॉडी में दर्द होगा. वी कॉल दिस पॉलीमाइल्गिया रोमैटिका. तो आपको सिर्फ इतना याद रखना है, विच वस्कुलाइटिस इज एसोसिएटेड विथ पॉलीमाइल्गिया रोमैटिका. आंसर इज टेम्पोरल आर्थराइटिस. डन. ओके, नाउ कमिंग टू दिस सेम, ये टेम्पोरल का, ये टेम्पोरल यू कैन रिमेंबर बाय निमोनिक रूल ऑफ 60. रूल ऑफ 60 मीन्स इट इज सीन इन फीमेल अबव 60. फीमेल जिनकी एज 60 से ज़्यादा है. पेशेंट का ESR विल बी मोर देन 60. एंड इन ट्रीटमेंट व्हाट वी गिव, 60 milligram prednisolone. Most common symptom will be headache, most dangerous blindness, and I told you like close to 40% patient will develop polymyalgia rheumatica. Takayasu, understand, Takayasu में टेम्पोरल जैसे सिम्टम होते हैं. जस्ट रिमेंबर दिस Takayasu. मोस्ट कॉमन आर्टरी हेयर कौन सी होगी, एनीवन, कौन सी आर्टरी? मोस्ट कॉमन आर्टरी हेयर विल बी सब क्लेवियन आर्टरी. अब देखो, सब क्लेवियन आर्टरी इज डीप आर्टरी. सो इसको डायग्नोस करने के लिए यू विल नॉट डू बायोप्सी. सो बिकॉज अगर बायोप्सी करोगे दैट कैन लीड टू रप्चर, दैट कैन लीड टू ब्लीडिंग. सो हाउ वी मेक अ डायग्नोसिस, हियर वी विल मेक अ डायग्नोसिस बेस्ड ऑन CT एंजियो. but treatment will be same. We need to give steroid. Lastly, I can say this Takayasu will increase risk of renovascular hypertension. Renovascular hypertension, and this is something which is very commonly seen in Asian people. Means it's very common. It is one of the common cause of renovascular hypertension in young patient, and patient will be generally less than 45. तो पेशेंट ज़्यादातर आप देखोगे 50 साल से कम का होता है. तो MCQ में अगर आप 50 साल से कम दोगे तो क्या बजर दबाना है? इफ़ इट इज़ लेस देन 49, इट इज़ टाकायासु. इज क्लियर? या CTA is CT angiography. Okay, moving to PAN. PAN means polyarthritis nodosa. So understand this thing. PAN is something which will not involve lung. Yeah, it is a multisystemic disease, but it will not affect which organ? Lung. There is no granuloma. It will involve kidney, but RBC cast are absent. And remember, 30% patient will have hepatitis B association. अब पान में अंडरस्टैंड दिस थिंग. व्हाट MCQ दे आस्क यू जनरली, यहाँ से दे आस्क यू पैथोलॉजी क्वेश्चन, यहाँ से पैथ का क्वेश्चन पूछते हैं. So what path question they ask you in exam? First is they'll ask you PAN is which type of hypersensitivity. So it is a type 3 hypersensitivity. अब type 3 hypersensitivity तो इसमें क्या मिलेगा? So type 1 is called anaphylactic, type 2 is called cytotoxic, type 3 is immune complex. So here you will find immune complex. Second question also they ask you in pathology, right? Yes, honey baseball equipment. HBS antigen को बोलते हैं ऑस्ट्रेलियन एंटीजन. HBS antigen is called Australian antigen, right? Yes, pulmonary artery is not involved. Sometimes it can involve bronchial artery. Now understand this thing. They ask you. Second question also they ask you in pathology, like which type of necrosis you will see. That is called fibrinoid necrosis. तो मेडिसिन का क्वेश्चन आपके एग्जाम में नहीं पूछा है, लेकिन अगर पूछेंगे तो क्या पूछेंगे? दे विल आस्क यू पान इज अ मल्टी सिस्टमिक डिसीज. Multi-systemic disease. Multi-systemic means it will affect artery of multiple organ. तो अब आपसे क्या पूछेंगे? आपसे they will ask you what is the cause of death. So this is my expected question. Cause of death. अब देखो इसको समझो थोड़ा सा. Anyone can guess? Any guesses? Happy baseball equipment. RDC बताओ. Mimomania. शेख. अमाद वली शेख. कोई बताओ. Try to answer. What is the cause of death? देखो generally what we study, cause of death is respiratory involvement or heart involvement. यहाँ पर क्या होगा बताओ? Anyone? Understand this thing? It is GI infarction. So this is unique. GI infarction or GI perforation. इसकी वजह से पेशेंट की डेथ होगी. सो हियर कॉज ऑफ डेथ इज GIT इन्वॉल्वमेंट. मूविंग टू कावासाकी डिसीज. सो अंडरस्टैंड कावासाकी डिसीज. सो यू कैन रिमेंबर लाइक मेनी निमोनिक्स आर गिवन क्रीम चाइल्ड, लेकिन मैं आपको बताऊंगा आपको कैसे याद रखना. यू हैव टू रिमेंबर दिस विद अनदर नेम. म्यूको क्यूटेनियस लिम्फ नोड सिंड्रोम. कावासाकी इज ऑल्सो कॉल्ड एज म्यूको मीन्स म्यूकोजा इन्वॉल्वमेंट. अब देखो जहाँ जहाँ पर म्यूकोसा होगी तो वहाँ की इन्फ्लेमेशन मीन्स you can see conjunctivitis. So patient can develop conjunctivitis. Female baby, if it's a female baby it could be vaginitis. Nose inflammation, nose of mucosa, rhinitis. Skin में क्या होगी? Rash होगी. Lymph node means LAD is lymphadenopathy. So children affected are less than 5 years. You can see erythema of palms and soles, strawberry tongue because oral cavity is a mucosa. And this, remember, this was last year NICT question. It is non-purulent conjunctivitis. Non-purulent. So देखो इसको अब आप या तो निमोनिक से याद करो, लेकिन निमोनिक एग्जाम में कई बार भूल जाते, तो याद रखो म्यूकोसा कहाँ कहाँ पर है. म्यूकोसा मीन्स कंजंक्टिवा इज अ म्यूकोसा, वेजिना इज अ म्यूकोसा, नोजल कैविटी नोज इज अ म्यूकोसा, स्किन रैश, क्यूटेनियस मीन्स स्किन, एंड लिम्फ नोड मीन्स लिम्फेडेनोपैथी. जब इतनी जगह सब कुछ होगा तो फीवर भी आएगा. डन. नाउ अंडरस्टैंड वी हैव एंटी एंडोथेलियल antibody, so ultimately this will increase the risk of MI. So simple याद रखना. क्लिनिकल केस they will ask you in medicine or in pediatrics. अगर किसी छोटे बच्चे को MI आ रहा है, think of Kawasaki. That's it. Now coming to treatment of choice, how you will treat this. So treatment of choice in this condition will be IVIG, IV immunoglobulin. Done. So remember, any small child is having MI, think of Kawasaki. So you can see I have fever. Red are my eyes means conjunctivitis. Lips and tongue swollen in my coronary artery. Neck with lymph node, but my heart will go on. And he need aspirin and IV gamma globulin. Right? Okay, moving to next disease like Behçet disease. Behçet disease. So understand this thing. Here you will see in the MCQ you will get a hint like it will be a young smoker. Disease will start from artery, then it will affect vein, then it will affect your nerve. So patient को neuropathy वाले symptom भी होंगे. So what is not involved? What is spared here? This disease will spare lymph node. Lymph node involved नहीं होते. Right? So patients having history of smoking. So what do we call this? We call this thromboangiitis obliterans or Behçet disease. Behçet disease. अब मुझे बताओ how you are going to diagnose this. So उसका diagnose clinical है. You don't need any other testing. And how you are going to treat this? So it is a complete smoking cessation. Smoking cessation के लिए क्या करोगे? Yes, they will start question like this. It will be like a 30-year-old young male smoker with pain in hand, claudication, then numbness, tingling sensation. हाथ पैरों में सुन्नपन भी हो रहा है. Why numbness? Because of involvement of nerve. Right? Then patient is having formation of black discoloration of fingers means gangrene बन रहा है. So understand this thing. Smoking cessation means यहाँ पर निकोटिन की कोई च्युइंग गम भी नहीं देनी है आपको. निकोटिन च्युइंग गम पैच दे आर कॉन्ट्राइंडिकेटेड बिकॉज देखो पैच च्युइंग गम कब देते हैं? उसका फ़ायदा होगा कि निकोटिन आपके लंग्स में नहीं जाएगा बट ब्लड में तो जा ही रहा है. सो हियर व्हाट वी यूज़ एन एंटीऑक्सीडेंट ड्रग. दैट एंटीऑक्सीडेंट ड्रग्स विल बी पेंटॉक्सीफाइलिन. So drug that we use here will be pentoxifylline. Okay, now coming to Wegener disease. So Wegener disease, it will affect any age, but it is rarely seen in children. So Wegener's को आपको कैसे याद रखना है? Just remember, there is upper respiratory tract involvement, there is lower respiratory tract involvement, and there is kidney involvement. अब इसको देखो. Upper respiratory tract, what I mean? It is upper respiratory tract means rhinitis, means nose involvement. नाक में पॉलिप बनना, पॉलिप्स फॉर्मेशन इन नोज, साइनोसाइटिस. लोअर मीन्स ब्रोंकाइटिस. ब्रोंकाइटिस की वजह से क्या होगा? पेशेंट विल हैव हेमोप्टिसिस एंड किडनी इन्वॉल्वमेंट मीन्स ग्लोमेरुलोनेफ्राइटिस. एंड बिकॉज ऑफ ग्लोमेरुलोनेफ्राइटिस यू विल नोटिस देयर इज हेमाचूरिया. So now try to understand this thing. Patient will have upper respiratory tract involvement plus lower plus kidney. अगर मैं आपको बोलूँ upper का involvement ही नहीं है, there is only lower involvement and involvement of kidney, then this is not Wegener's, then this is good pasture. देखो अगर तीनों होंगे तो Wegener, अगर दो होंगे तो good pasture. So how we can differentiate? So differential diagnosis of Wegener's will be good pasture syndrome. तो गुड पास्चर विल नॉट हैव अपर रेस्पिरेटरी ट्रैक्ट इन्वॉल्वमेंट. तो गुड पास्चर में कौन सी एंटीबॉडी होगी? एंटी एंडोथीलियल एंटीबॉडी. विच एंटीबॉडी? एंटी बेसमेंट मेम्ब्रेन, एंटी ग्लोमेरुलर बेसमेंट मेम्ब्रेन एंटीबॉडी, एंटी GBM. बट इफ यू सी ऑल दीज थ्री फीचर दैट इज कॉल्ड Wegener's. सो Wegener's देखो, सैडल नोज, यू कैन सी अ डिप्रेशन द नोज, स्ट्रॉबेरी गम्स, कैविटेटरी लीजन. दिस इज द हिंट इन द MCQ. Pauci-immune RPGN means RPGN type of glomerulonephritis. And in treatment, drug of choice will be cyclophosphamide. Diagnose करने के लिए क्या चाहिए? सियंका. So Wegener's की स्पेलिंग को मैं Wegener's कर दे रहा हूँ. Look at the screen. Wegener's means अगर मैंने Wegener's कर दिया, C for सियंका, C for cyclophosphamide. Simple. So याद रखना, Wegener's and good pasture both will have LRT and kidney involvement. तो आप कैसे डिफरेंशिएट करोगे? Upper respiratory tract involvement. Very very important. This is a saddle nose. You can see a depression in the nose which we see in Wegener's. Coming to Henoch-Schönlein purpura, understand we also call this IgA vasculitis. So patient will have IgA. It is associated. This disease is also associated with IgA nephropathy. और ये टॉपिक जो क्या है FMGE एग्जाम में बार बार पूछे भी जा रहा है. You will see immune complex deposition. It is most common vasculitis in children. In Indian children, Kawasaki is slightly more common. So patient will have palpable purpura colic abdominal pain. So diagnosis you will make based on clinical symptom, and how we are going to treat in treatment. Understand, initially it is self limiting, लेकिन अगर पेशेंट को जोर का पेट में दर्द हो रहा है, या फिर 2 हफ्ते बाद भी ठीक नहीं हुई अपने आप, या फिर पेशेंट को जीआई ब्लीडिंग है, देन वी गिव स्टेरॉइड. सो दिस क्वेश्चन केम इन INICET रिसेंटली. स्टेरॉइड आप कब कब दोगे? सो व्हाट आर द इंडिकेशन ऑफ गिविंग स्टेरॉइड? वी विल गिव स्टेरॉइड व्हेन इट इज, देयर आर 3 इंडिकेशन. सपोज इनिशियली इट इज़ नॉट सेल्फ लिमिटिंग, 2 हफ्ते तक आपने पेशेंट को मल्टीवाइटामिन दी, फिर भी वो ठीक नहीं हुआ. सेकेंड इंडिकेशन इज पेशेंट हैविंग सीवियर एब्डोमिनल पेन. अगर पेशेंट को ज़्यादा पेन हो रहा है, छोटा बच्चा रोए जा रहा है पेट के दर्द से, और पेशेंट हैविंग एनी ब्लीडिंग especially GI bleeding, in that case we will start steroid even in the first visit. So this type of photo image based question they ask in exam. This is the rash of HSP. Done. Okay, this is Churg-Strauss syndrome. So understand, in Churg-Strauss syndrome you will see this is something which mimic asthma. It is something which mimic asthma. So patient will have rash, right? There will be like increase in eosinophils. You will see eosinophilia. Eosinophils number will increase, and sometimes you will notice there is a mononeuritis, an asymmetric mononeuritis. So for diagnosis what we need P Anka, and in treatment what we give steroid. So basically it is something which look like asthma. Okay, coming to Behçet syndrome. Behçet syndrome को हम Silk Road disease भी बोलते हैं. So patient will have multiple oral ulcers. So most common will be oral ulcers, but most classical or more specific will be genital ulcers. So बार बार oral ulcer होंगे, बार बार genital ulcer होंगे. वो दोनों कैसे होंगे? Both are painful. Then there will be uveitis. Pathology test will be positive. आप एक sterile needle patient को जब लगाओगे तो वहाँ एक बम्प बन जाएगा. HLA B5 और B51, और लेकिन अल्सर ठीक हो जाएंगे without leaving a scar. So we also call this Silk Road disease, Behçet syndrome, and in treatment what we give steroid. In treatment we give steroid. So this is pathology test that we do for Behçet disease or Behçet syndrome. A very rare type of vasculitis, just आपको याद रखना है, this is something which is associated with hepatitis C, that is called cryoglobulinemia और essential, पूरा नाम होता है essential mixed cryoglobulinemia और cryoglobulinemic vasculitis. Now let us see the MCQ part. Most common lung manifestation of SLE, pleuritis. Which disease cannot be diagnosed without ANA positivity? Again it is SLE. Non-tender nodule on extensor surface in RA patient, it is rheumatoid nodule. बेस्ट टेस्ट फॉर गाउट के लिए बेस्ट टेस्ट क्या होगा? साइनोवियल फ्लूइड एनालिसिस. मीन्स ये आपको कहाँ से करना पड़ेगा? दिस सैंपल यू नीड टू टेक फ्रॉम जॉइंट एस्पिरेशन. ड्रग ऑफ चॉइस फॉर एक्यूट गाउट, एनसाइड्स. पल्सलेस डिसीज इज अनदर नेम ऑफ टाकायासु. रोमैटिक फीवर के लिए क्या करोगे आप? ASO और ASLO, एंटी स्ट्रेप्टोलाइसिन O. यू कैन राइट ASO और ASLO, एंटी स्ट्रेप्टोलाइसिन O. एंटीबॉडी इन HSP, it is IgA. LE cells you will see in SLE. वैगनर्स में कौन सी एंटीबॉडी होगी? सियंग का. इन गुड पास्चर एंटी GBM. गोवर साइन यू विल सी इन डुशेन मस्कुलर डिस्ट्रॉफी. गोवर साइन मीन्स पेशेंट किसी टेबल का या आसपास पड़े ऑब्जेक्ट का हेल्प लेगा अगर बैठा उससे खड़ा होने के लिए. डुशेन मस्कुलर डिस्ट्रॉफी, दिस इज नॉट इन गर्ल्स बिकॉज एक्सलिंग रेसिसिव. RA में कौन सा जॉइंट इन्वॉल्व नहीं होता? DIP. और याद रखना DIP इज मोस्ट कॉमन जॉइंट इन्वॉल्व इन सोरियाटिक आर्थराइटिस. हाइपर कैल्सीमिया, दीज आर द PYQs. ये आपके एग्जाम में वो क्वेश्चन जो आ चुके हैं. हाइपर कैल्सीमिया यू विल सी वेयर? इन सार्कोइडोसिस. रोमैटिक फीवर विल कन्वर्ट इनटू रोमैटिक हार्ट डिसीज. तब पेशेंट को क्या हो जाएगा? MR हो जाएगा. सो रोमैटिक फीवर में MS होता है, आगे जाके इट कैन कन्वर्ट इनटू MR. नाउ दे आस्क यू नॉट अ मेजर क्राइटेरिया इन रोमैटिक फीवर. तो उसको हम कार्डियोलॉजी पढ़ेंगे, व्हाट आर द मेजर माइनर फीचर. तो ये बार बार इस टाइप का क्वेश्चन आता है एग्जाम में, इसलिए लिखा हुआ है. एंटीरो इज नॉट सीन इन एंकाइलोजिंग स्पॉन्डिलाइटिस. एंटीरो मिलती कहाँ पर? सो एंटीरो, वेयर वी विल सी एंटीरो यू विल सी इन Sjögren syndrome. एंटीरो यू विल सी इन neonatal SLE. and anti-rho you will see in other SLE form. Most specific test for SLE, it is anti-Smith. Martel sign you will see where in gout patient. रूमेटॉइड आर्थराइटिस में कौन सा एम्लोडोसिस होता है? ए एम्लोडोसिस. देखो हर क्रोनिक इन्फ्लेमेशन में ए एम्लोडोसिस होता है. कौन सी क्रोनिक इन्फ्लेमेशन में एम्लोडोसिस नहीं होता? आंसर इज क्रोनिक ब्रोंकाइटिस. HLA DR4, HLA DR3, HLA DRB104. याद रखना HLA B27 यानी होता. गोल्ड को पहले यूज़ करते थे, अभी नहीं करते. गोल्ड वॉज यूज इन बिफोर in the treatment of RA. So this is about your rheumatology. So take a short nap, short break. After this break, we'll start our discussion of hematology and nephrology. So come back. We'll resume the session in 10 minutes. We'll start at 15:50. ओके गाइस, सो स्टार्ट करते हैं नेफ्रोलॉजी को. लेट्स टॉक अबाउट किडनी डिसीज. So just try to understand first some basic information. Kidney receive 20% of cardiac output. So ये भी एक क्वेश्चन है खुद में. So we have terms, some terminologies like polyuria. Polyuria when you will call when urine output is more than 3 liter in a day. अगर आप एक दिन में 3 लीटर से ज़्यादा यूरिन रिलीज कर रहे हैं, that is called polyuria. Coming to oliguria. Oliguria you will call when it is less than 400 ml per day. When it is less than 400 ml per day. And anuria you will call when it is less than 100 ml per day. Urine output अगर 100 ml से कम हो गया, we call this anuria. Now they ask you like what is ideal time for urine test. So कौन सा sample आपको लेना चाहिए? At the best sample will be second morning midstream sample. Second morning midstream sample. This is the best sample for urine collection, right? Now coming to we have specific gravity. देखो normal specific gravity आपकी variable होती है. So normally specific gravity is 1.020 to 1.030. अगर specific gravity fix हो जाती है, if it is fixed, this is a sign of CTID. CTID means chronic tubulointerstitial disease. तो इसको हम बोलते हैं fixed specific gravity or what we call this? We call this isosthenuria. Isosthenuria. Specific gravity बढ़ेगी कब? It is increased where in SIDH, and specific gravity it is decreased. So decreased specific gravity you will see in a patient with diabetes insipidus. That specific gravity कम का होगी? Diabetes insipidus. Now try to understand what type of question they ask you in exam. So कभी कभी question आता like they will give you in the MCQ like hematuria. So hematuria means patient is having blood in urine. Hematuria maybe it is glomerular or non-glomerular. So अगर मैं आपसे पूछूं hematuria का most common cause will be kidney stone. So this hematuria is called non-glomerular. So hematuria को glomerular कब होगा? Hematuria is glomerular. Glomerular means it is due to glomerulonephritis. So this you can remember by a 45-1 rule. So देखो they will give you a question like a patient having hematuria. So remember most common cause will be kidney stone or ureteric stone. लेकिन अगर question glomerulonephritis का है, so remember 45-1 rule means if you see 40% or more dysmorphic RBC, अगर आप 40% या उससे ज़्यादा अलग अलग शेप की RBC देखोगे, और if you see 5% or more acanthocytes, if you see 4% or more acanthocytes, or you will see any one RBC cast, one single RBC cast, then this hematuria is considered glomerular. So मेरे कहने का क्या मतलब है? अगर क्वेश्चन में dysmorphic RBCs दिए हैं in the MCQ, if you see acanthocytes are given, if one single RBC cast is given, then this hematuria is due to glomerulonephritis or it is glomerular in origin. They ask you question on different types of cast. आपसे question cast से पूछते हैं. So we have RBC cast. So RBC cast you will see where in glomerulonephritis, especially in nephritic syndrome. WBC cast you will see in pyelonephritis. और कहीं पर मिलते हैं WBC cast? You will also see this where in allergic interstitial nephritis. In allergic interstitial nephritis. So here also you will see WBC cast. Hyaline class, these are normal. कभी कभी नॉर्मल लोगों में मिलते हैं, या फिर समटाइम यू विल सी दिस इन दोज पेशेंट हु ड्रिंक लेस वाटर, जो लोग कम पानी पीते हैं. फॉर एग्जांपल इन डिहाइड्रेटेड पेशेंट, सपोज आपने पानी कम पिया. समटाइम these hyaline casts, these are modified, and these are modified, so what we call them? We call them Tam-Hirschfeld protein. तो याद रखना Tam-Hirschfeld protein भी कुछ नहीं है, it is also a normal constituent. Broad granular cast or waxy cast, it is something which we see in CKD. and pigmented muddy brown cast, it is seen in AKI. AKI can occur due to ATN. ATN means acute tubular necrosis. So these are some of the casts. एक और कास्ट जो मैं यहाँ बताऊँगा, that is called your fatty cast. We can call this fatty cast or lipid cast. Fatty cast or lipid cast. This is something which we see in nephrotic syndrome. It is something which we see in nephrotic syndrome. Done? एक बार बोल दो. Okay. Now understand this thing. DTPA, हमारे पास दो स्कैन होते हैं, DTPA स्कैन और DMSA स्कैन. DTPA स्कैन और DMSA स्कैन, इसको समझो एक बार. So normally what we have two tests. दो टेस्ट होते हैं हमारे पास. We have like urine routine microscopy और KFT. इसके बाद अगर आपको किडनी डिसीज को देखना है, like we want to know some, if you want to see some morphological defect, means किडनी की morphology या anatomy में कोई दिक्कत प्रॉब्लम है, then what we do? Then you will do a test. This scan means morphological defect or anatomical defect. Morphological or anatomical defect. For this what we had DMSA scan. But agar if you want to see kidney function, if you want to know about kidney perfusion defect, or I can say functional defect. So for functional defect what we have DTPA scan. Done? Okay, right. रितेश इज माई स्टूडेंट. रितेश अच्छा पढ़ रहे हो. इस बार रितेश से एक्सपेक्टेड है 200+ मार्क्स लाएगा ये. अगर ये 200+ मार्क्स लाएगा तो इसकी पीजी की फ़ीस स्पॉन्सर मेडूहब से करा देंगे. ठीक है, मेडूहब करेगा इसकी पीजी की फ़ीस स्पॉन्सर. डन. हॉर्स शू किडनी. सो अंडरस्टैंड दिस थिंग. हॉर्स शू किडनी मीन्स इफ यू सी दिस किडनीज. सो रितेश से एक्सपेक्टेड है इस बार 200+ मार्क्स इन एग्जाम. So now see horseshoe kidney, when you see like kidney, these are fused at lower poles. So ऐसी किडनी में ज़्यादा प्रॉब्लम नहीं होती. This is one of the common, I can say it is most common anatomical defect of kidney. Most common anatomical defect of kidney. So ज़्यादा प्रॉब्लम नहीं आती, जस्ट बार बार पेशेंट को पथरी होती है. In IVP, in intravenous pyelogram, you will call this as a flower vase appearance. तो दिस इज लाइक आप यहाँ पर एक फ्लावर लगा सकते हो. वी कॉल दिस अ फ्लावर वेस अपीयरेंस. ओके. मोस्ट कॉमन किडनी ट्यूमर इन अडल्ट. एनीवन? अडल्ट में कौन सा होगा? इट इज RCC. बट इन चिल्ड्रन दिस इज विल्म्स ट्यूमर. इन चिल्ड्रन इट इज विल्म्स ट्यूमर. डन. इन चिल्ड्रन इट इज विल्म्स ट्यूमर. ओके. नाउ लेट्स टॉक अबाउट रीनल फंक्शन. किडनी के फंक्शंस की बात करते हैं. सो व्हेन वी हैव किडनी फंक्शंस, so glomerular functions check करने के लिए we have creatinine clearance, we have inulin clearance. Then what else we have some more things, like we have, like nowadays even better than this, we have an equation called MDRD formula. MDRD formula means modification of diet and renal disease. और इससे भी बेटर होता है EPI cystatin C method. EPI cystatin C method. So this is for renal function. ट्यूबुलर फंक्शन के लिए वी हैव वाटर डिप्रीवेशन टेस्ट. ओके. GFR निकालने के लिए एक ओल्ड फार्मूला, वी हैव एन ओल्ड फार्मूला दैट इज कॉल्ड कोक्रॉफ्ट-गोल्ट फार्मूला. वी कॉल दिस कोक्रॉफ्ट-गोल्ट फार्मूला. So this is for GFR. Now understand, for tubular function we have water deprivation test, and for plasma flow we can estimate by renal plasma para-aminohippuric acid. So these are the MCQ which they ask in exam. राइट. अभी एक्सपेक्टेड क्या है? एक्सपेक्टेड इज EPI एंड MDRD, बिकॉज आजकल जितनी भी KFT की रिपोर्ट होती है, सो देज आर बेस्ड ऑन MDRD एंड EPI cystatin C method. Done. Now try to understand. Then let's talk about kidney disease one by one. So one of the common disease which they ask in exam is ciliopathy. Ciliopathy means these are the defect in cilia, and because of defective cilia you can see formation of cyst in the kidney. किडनी में cyst बन जाएंगे. So we also call them cystic kidney disease. Cystic kidney disease. So now try to understand. In cystic kidney disease, what is important? The most important will be ADPCKD. ADPCKD means autosomal dominant polycystic kidney disease. Next important will be ARPCKD, autosomal recessive polycystic kidney disease. Then we have MCKD. This MCKD will have two subtypes. We have MBUC1 mutation and U-mod gene mutation. Then we have nephronophthosis and MSKD. MSKD is medullary sponge kidney disease. MCKD is medullary cystic kidney. MSKD is medullary sponge kidney disease. But for exam purpose, most important will be ADPCKD and ARPCKD because these are the common thing which they ask in exam. ये बार बार पूछते हैं. अब इसको समझो एक बार. In ADPCKD, what they ask you, this is something which is a defect at chromosome 16 or chromosome 4. ARPCKD is a defect at chromosome 6. ADPCKD is seen in adult. ARPCKD, this is seen in infant. Infant means इनकी death, I can say, एक साल के अंदर डेथ हो जाती है. सो व्हाट वी कॉल दम जनरली डेथ अकर बिकॉज ऑफ लंग इन्वॉल्वमेंट, पल्मोनरी हाइपोप्लेशिया की वजह से डेथ होती है. सो दीज पेशेंट विल हैव डेथ बिकॉज ऑफ pulmonary hypoplasia. Done. And ADPCKD, so this will have variable onset. अब इसको थोड़ा समझो. They ask you in exam in ADPCKD what are other things. तो ADPCKD को मैं यहाँ लिख रहा हूँ. So ADPCKD other feature you can remember by mnemonic. That mnemonic is a rule of B. So what is rule of B? Understand, ADPCKD, it is something which is commonly seen in boys. This is bilateral, so patient को दोनों किडनी में ज़्यादातर सिस्ट होती है. तो पेशेंट का बीपी भी बढ़ता है इसमें. So patient will have hypertension. It is mainly affecting black, means African लोगों को ज़्यादा अफेक्ट होती है. Then you can notice patient will have Behçet aneurysm. डिसीज किडनी की है बट ब्रेन में एनोरिज्म बनते हैं. एंड रिमेंबर Behçet aneurysm बनते रप्चर. अगर ये रप्चर होते हैं देन पेशेंट कैन डेवलप SAH. SAH मीन्स subarachnoid hemorrhage. Now try to understand. They ask you like patient will also have bicuspid valve involvement. Bicuspid valve involved means disease kidney की है लेकिन mitral valve को involve कर रही है. Mitral valve means it's involving your heart. And last B is you can see biliary cyst. Means after kidney you can see cyst also affect your liver. So अब आपसे क्वेश्चन पूछते हैं cyst कहाँ कहाँ बनती है. So remember you will see cyst mainly in the kidney. After kidney you can see cyst in the liver. After liver you can see cyst in seminal vesicles. You can see cyst in the pancreas and even you can see cyst in the brain. कहाँ पर cyst नहीं बनती? It's an MCQ that they ask in exam. So answer is lungs. So you will not see cyst where in lungs. So this is something which you have to remember about ADPCKD. Clear? RDC Ritesh, happy baseball equipment. Am I clear? आगे चलो. So this is about your PCKD. Or now let's talk about CKD. CKD means they ask you different question in exam. So let's say overt symptom of kidney failure will begin when kidney function will deteriorate by more than 70%. अगर 70% से ज़्यादा किडनी ख़राब हो गई देन यू विल सी अ लॉट ऑफ सिम्टम. अब ये क्वेश्चन बार बार पूछते हैं लाइक CRF का पेशेंट है और अनीमिया साथ में हो रहा है. सो अंडरस्टैंड दिस थिंग. इन किडनी डिसीज पेशेंट विल डेवलप नॉर्मोसाइटिक नॉर्मोक्रोमिक अनीमिया. So how you will treat this anemia? So for this anemia the best treatment, so we can use iron supplementation, we can use blood transfusion, but what is best will be recombinant erythropoietin. So best is recombinant erythropoietin, like we have epoetin alpha, darbepoetin alpha. एक और क्वेश्चन आपसे पूछते हैं, अगर आपको आयरन सप्लीमेंट देना है देन विच आयरन प्रिपरेशन वी विल यूज. सो रिमेंबर ferrous carboxymaltose is preferred. Do not use any other iron preparation. Only this carboxymaltose is recommended in CKD patient or CRF patient. Done. Now you can see this is PCKD. तो PCKD से क्वेश्चन एग्जाम में पूछते हैं. You can see multiple cysts in kidney. एक और MCQ पूछते हैं एग्जाम में like how we can make a diagnosis of PCKD. So how we can make a diagnosis? So we have two criteria to make a diagnosis. One is called एक नाम याद रख लो, एक होता है Raven's criteria and second is what is given in Harrison. So दोनों में ज़्यादा अंतर नहीं है. So Raven's criteria and Harrison's criteria, these are the criteria which we have to make a diagnosis of PCKD. So understand this thing. To make a diagnosis what we need, आपको क्या चाहिए diagnosis बनाने के लिए? So there should be like a family history of PCKD plus. सो पेशेंट के अंदर कुछ ना कुछ फैमिली हिस्ट्री होना जरूरी है. फैमिली हिस्ट्री के साथ व्हाट इज इंपॉर्टेंट, अंडरस्टैंड व्हाट इज इंपॉर्टेंट, वी नीड टू सी द एज ऑफ पेशेंट. सो डायग्नोस आप कैसे बनाओगे, बाय लुकिंग एट द एज ऑफ पेशेंट. अब इसको समझो. सपोज यू कैन सी अगर पेशेंट की एज 15 से 30 और आई कैन से 29 ईयर है, 15 से 30, 30 to 59 and more than 60. If patient age is 15 to 29, then we need two cysts. Two cysts, and these cysts should be either unilateral or bilateral. या तो एक ही किडनी में दो हो या एक एक हो. 30 to 59, so what we need two cysts in each kidney. And if it is more than 60, then what we need four cysts in each kidney. So this is about the diagnostic, right? PDF में भेज दूँगा, मुझे टेक्स्ट कर देना, तो मैं I'll share the PDF, right? इसकी एक और क्लास होगी अभी, दिस इज़ द सेकंड क्लास, एक क्लास हो चुकी है. So this is like a diagnostic criteria, Raven's criteria for PCKD. Now see, second question that they ask in exam is they will give you a question on hematuria. Hematuria पेशेंट को हो रहा है आफ्टर sore throat. Sore throat means pharynx के मीन्स किसी को पहले sore throat हुआ, पेशेंट का पहले गला खराब हुआ, सो sore throat के बाद हेमाचूरिया हो गया. सो वी कॉल दिस, अंडरस्टैंड दिस थिंग. सपोज गला खराब आज हुआ और एक हफ्ते के अंदर हेमाचूरिया हो रहा है. इफ इट इज अकरिंग इन लेस देन 1 वीक, देन व्हाट वी कॉल दिस सिनफेरेंजाइटिक हेमाचूरिया. अगर एक हफ्ते के बाद हो रहा है, वी कॉल दिस डिलेड. So understand this thing, synpharyngitic hematuria you will see in IgA nephropathy and delayed you will see in PSGN. बस आपको ये दो चीज़ें याद रखनी, very very important, because sometimes student make mistake. They will like question आया like a 30-year-old or 25-year-old person with hematuria after sore throat, हम सीधे आंसर मार्क कर देते हैं PSGN. So this hematuria you can also see in IgA nephropathy and also in HSP. Am I clear? So read the question carefully. HSP will also have skin rash, buttocks में rash होगी, so वो सारे फीचर HSP में और ऐड होंगे. Okay, now let's talk about kidney stone. So stones से question आता है, so they will ask you like which stones are radio opaque. So what are the radio opaque stone and what are the radiolucent stone? So radiolucent stone. So radiolucent stone कौन से होते हैं, radio opaque कौन से होते हैं? अब इसको देखो कैसे समझना है. So lucent means lux. So इंडिया का सबसे ज़्यादा यूज़ होने वाला साबुन कौन सा है? It is Lux. So Lux is India's top soap brand. So Lux means lucent. So lucent will be uric acid stone. Lucent will be xanthine stone. India's means Indinavir. Indinavir. Top means Tramptin. And soap means silica. बाकी सारे स्टोन कैसे होते हैं, ऑल अदर स्टोन विल बी रेडियो ओपेक. बस इतना याद रखना है आपको. दिस समथिंग विच यू हैव टू रिमेंबर. याद हो जाएगा. एम आई क्लियर? सो रिमेंबर दिस इज लाइक इंडियाज लक्स, इंडियाज टॉप सोप. बाकी कैसे होते हैं रेडियो ओपेक. नाउ अंडरस्टैंड, दे विल आस्क यू क्वेश्चन ऑन स्टोन शेप. आपसे क्वेश्चन स्टोन की शेप से पूछते हैं. तो इफ़ यू आस्क मी लाइक व्हाट इज मोस्ट कॉमन स्टोन, सो रिमेंबर मोस्ट कॉमन स्टोन विल बी कैल्शियम ऑक्सलेट स्टोन. दिस इज मोस्ट कॉमन. एंड इफ़ यू सी द शेप कैसी होती है इसकी, एनवलप शेप. देन रिमेंबर यूरिक एसिड स्टोन, दिस इज रोम्बॉइड इन शेप. उतना कॉमन नहीं है, कभी कभी दूसरी शेप में भी आ सकता है. देन दिस इज स्ट्रूवाइट स्टोन. स्ट्रूवाइट स्टोन से कई सारे क्वेश्चन एग्जाम में पूछते हैं. दे आस्क यू लॉट ऑफ क्वेश्चन एग्जाम फ्रॉम स्ट्रूवाइट. सो स्ट्रूवाइट स्टोन इज ऑल्सो कॉल्ड एज ट्रिपल फॉस्फेट स्टोन. वी कॉल दिस ट्रिपल फॉस्फेट स्टोन, or we call this as like staghorn stone. Staghorn stone. This is the only stone which will precipitate in alkaline pH, and this stone is associated with proteus infection. और अगर आप शेप की बात करो, this shape is called as coffin lid, जिसमें डेड बॉडी को लेके जाते हैं उसका ढक्कन. That's called coffin lid shape. Moving to next is cystine stone. अब इसको देखो, the cystine stone, if you see the cystine stone, this is hexagonal in shape. Hexagonal means benzene के रिंग जैसा होता है. And this is like I can say hexagonal है, and very H for hexagonal, H for hardest stone. It is hardest stone, right? So now one more MCQ which came recently is like we have a type of stone that is due to laxative. कुछ लोग कायम चूरन खाते हैं या बार बार पे सिरप लूज पीते हैं. So laxative abuse can precipitate a stone. जो लोग ज़्यादा laxative, especially Ayurvedic laxative or like loose जो आता है lactulose syrup, this can cause stone. So this stone is called ammonium urate stone. Ammonium urate stone, and this can occur because of laxative abuse. Moving to congenital. Okay, I'll speak in English now. Done. Congenital glomerulonephritis. So understand this thing. We have filtration selective barrier. Filtration selective barrier, also called as slit diaphragm. This slit diaphragm is made up of certain protein. So in this, what we have protein like nephrin, we have podosin, and we have alpha-actinin. Nephrin, podosin, alpha-actinin. अब इसको समझो, just try to understand this nephrin. This nephrin is made up of a gene. The gene for nephrin is called as NPHS1 gene. Podosin is made up of a gene. This gene is called as NPHS2 gene. Alpha-actin will have a gene TRPC6. Nephrin mutation will cause Finnish type of nephrotic syndrome. Finnish type of nephrotic syndrome. Podosin mutation will cause steroid resistant nephrotic syndrome, and alpha actinin mutation can cause congenital FSGS. Congenital. This is a live session, it is not a recorded session. I am seeing your messages, don't worry, you can ask your messages, you can ask your doubts straight away. We are going live. So now what they ask you in exam. Now look at the screen, they ask you what will happen if nephrin mutation, what will happen if there is podosin mutation. So A, B, C, D, E, F, G, H, I, J, K, L, M, N. N comes before P. Similarly, 1 comes before 2. So just remember, because in exam we have stress, and nephrin can become NPHS2, podosin can become NPHS1. So N comes before P, 1 comes before 2. Suppose if you got rank 1, if you got like I can say 260 marks in FMGE exam, you got rank 1. When you get rank 1, what you will tell everyone? You will tell everyone I got first rank. So F for Finnish, F for first. Suppose if you got rank 2, then what you will tell? You will tell I got rank S for second, S for steroid. So understand this thing. It is very simple. So NPHS1, it is nephrin. NPHS2, it is podosin, right? And remember, this NPHS1 means nephrin, NPHS2 is podosin. NPHS1 mutation, Finnish type. NPHS2 mutation, steroid resistant. So these are the things which you have to remember about glomerulonephritis. Done. Now understand, we'll talk about nephrotic syndrome in details. So first is, what are the diseases which we have in nephrotic syndrome, and what are the symptoms. So what are the examples and what are the clinical features of nephrotic syndrome. So first disease which I will say here is MCD. MCD means minimal change disease. Second disease which we have here is called as focal segmental glomerulosclerosis. And third disease which we'll have is called MGN. MGN means membranous glomerulonephritis. So minimal change disease, this is most common cause of nephrotic syndrome. Now understand, in all these nephrotic syndrome you will have a common clinical features. In nephrotic syndrome, common clinical features, and these features you can remember by a mnemonic: protein leak. Protein leak. Protein leak means patient will have proteinuria. Leak means lipiduria. There will be lipids in the urine, proteins in the urine. E for edema. A for albumin decrease. So in blood you will see protein का loss हो जाएगा तो albumin कम हो जाएगा, simple. Hypoalbuminemia. So you will see loss of protein, so albumin is also gone. So albumin will decrease in blood, you will see hypoalbuminemia. One protein is not being lost, that protein is called as fibrinogen, and because of this you will notice coagulation will increase. Coagulation will increase means hypercoagulability. Done. Now what they ask you some coagulation factors in nephrotic syndrome. So remember, there is increased platelet aggregation and activation, increase in factor 5, 7, 8, 13 and fibrinogen. Then you can see decreased antithrombin 3, decreased protein C, decreased fibrinolysis. So these things are decreased. Fibrinogen is important, so that's why I'm writing this again. This is very, very important. They ask you in exam. Increase alpha 2 antiplasmid, decrease plasminogen, right? Then you can see factor 12 synthesis will also reduce. Now, what are the questions they ask in minimal changes is, so this is most common cause of nephrotic syndrome in children and overall. In children and overall. Then try to understand minimal changes is having selective proteinuria. So what are the meaning of selective proteinuria? Means there is only loss of albumin. बाकी proteins generally नहीं जाती हैं. Only loss of albumin. Only albumin is lost. Then understand, they ask you like hypertension, hematuria is rare. Main feature will be edema. Edema is the main feature and very, very important. Prognosis is excellent. And treatment. Why prognosis is excellent? Because when you start steroid for 2 weeks, you will see a complete recovery. जैसे ही आप पेशेंट को स्टीरॉयड दोगे, whenever you give steroid to patient for 2 weeks, you will have a decent recovery. These are the MCQ that they ask on minimal changes. Done. Moving to FSGS. So understand, this FSGS is something which is I can say a type of nephrotic syndrome which is seen in adults, and this is mainly affecting adults of developing or underdeveloped countries. In this FSGS, you will see like how we differentiate this from minimal change disease. Minimal change disease is mainly seen in children. Here you will see a very poor response to steroid. अब इसको समझो जरा ध्यान से, try to understand. In MCD what I told you, there is an excellent response. Steroid का response कैसा आएगा? Excellent response. Here you will see a very poor response to steroid. Poor response to steroid means prognosis is also poor. You can see poor prognosis. Now understand, we have different types. इसके कई सारे types होते हैं, like nose tip type, perihilar type. But the type which is important is collapsing type. This is most dangerous type. This collapsing type is seen in HIV. HIV patient, and what we call this now? We call this HIVAN. HIVAN means HIV associated. First class video, you can see like there is a video. You just go to MeduHub YouTube channel, then you can notice there is a section, go to live section. In live section you can see the previous video, right? Okay, I repeat, just you need to go to MeduHub YouTube channel, then open the live class. There is an option of live, click that, there you can get the previous class also. This collapsing type is something which is seen in HIV, and this will have worst prognosis. This will have worst prognosis. तो इसका prognosis सबसे खराब होगा. Am I clear? So collapsing type will have worst prognosis. Done. Okay, now coming to MGN. MGN means membranous glomerulonephritis. Now understand, this MGN is something. This is like a type of nephrotic syndrome, where what we can see, this is also seen in adult, but it is mainly affecting developed countries. It is affecting adult of developed countries. In MGN, understand, you will see same feature, तीनों में same होगा. You will see protein leak, proteinuria, lipiduria, edema, right? Hypertension. These are same features. Then in MGN, understand, you will see like a moderate response. In MGN, you will see a moderate response means steroid का देखो उतना response अच्छा नहीं आएगा, उतना बुरा भी नहीं आएगा. So prognosis is also moderate. You will not see like a bad prognosis. Now what they ask you in exam, और क्या आपसे पूछते हैं, they will ask you like when you see MGN patient. So this MGN like nephritis you will see in rat, and this is what we call this Hayman's nephritis. MGN like nephritis you will see in rat, and what we call this Hayman's nephritis. Now try to understand, when we see this MGN patient, जैसे ही आप patient को देखोगे, in biopsy what you will find spike and dome pattern. In MGN you will find spike and dome pattern. Done. So these are the MCQ that they ask you on MGN. Okay, now moving to nephritic syndrome. अब बात करते हैं nephritic की. So what are the diseases in nephritic syndrome? So what are the examples? And I can say what are the clinical features. First, let me talk about clinical features. So in nephritic, the main feature which we see in nephritic, this will be hematuria. अब इसको समझो, just try to understand. अगर patient को, if patient is having daily hematuria, then because of hematuria he will develop anemia. तो patient को खून की कमी हो जाएगी, he will develop anemia. Then understand, as disease progresses, you can see toxins will build in the body, so there is azotemia. Azotemia means there is increase in blood urea nitrogen. Then patient urine output will decrease, you can see oliguria. I told you urine output will be less than 400 ml. Then because toxins are building in the body, then patient BP may increase, you can see hypertension. And here also you can see a minimal proteinuria. Minimal means in nephrotic proteinuria is more than 3.5 gram per day. Here you will see proteinuria, but this proteinuria is not more than 3.5 gram. This is less than 3.5 gram per day. Done. So proteinuria you will see, and this proteinuria will be generally less than 3.5 gram per day. Am I clear? So this is about your clinical feature of nephritic. Now what are the diseases? कौन सी disease होती है nephritic में? What are the diseases which we have here? So these diseases you can remember with the help of a mnemonic परी. ये परी है, पापा की परी नहीं है. What are the diseases which we have here? Pari means we have PSGN. PSGN means post streptococcal pneumonitis. A for Alport syndrome. R is RPGN. I is IgA nephropathy. With A we have one more condition called anti-GBM. Now tell me where just now I told anti-GBM. मैंने कहाँ पर बोला था anti-GBM? Where I told? Anyone? कौन बताएगा? Where I told anti-GBM today? Just now, come on. Ahmed Wali Sheikh 0x Rohit बताओ. Where you can see anti-GBM? Where I told? Anyone? Good pasture, na? Anti-GBM is another name of good pasture syndrome. Done. So now understand this thing. One by one we'll talk about these diseases. So starting with the first one, first will be your PSGN. इसको समझो एक बार. So we have PSGN. This PSGN is something where I told you just now. It is, you can see, like patient will have sore throat, and sore throat after 2 weeks. 2 weeks later, you will develop hematuria. So what do we call this? We call this delayed hematuria. And this sore throat you will see, it is done by which bacteria? It is done by GUPS. What is GUPS? GUPS का मतलब होता है group A beta hemolytic streptococcus, right? So we call this like delayed hematuria. Now try to understand, we will have antibodies. So what antibodies you will find here? You will find anti-DNase. So most patient will have anti-DNase. Sometimes you can see like anti-hyaluronidase and an ASO antibody. Anti-hyaluronidase. So mostly you will find anti-DNase. Then remember, they ask you question in biopsy. If you do biopsy in histopath, you will find subepithelial humps. You will find subepithelial humps, and this pattern is what we call, इसको बोलते हैं lumpy bumpy pattern. And sometimes you will also get starry sky appearance. Done. No, treatment की अगर बात करूँ, so treatment, understand, it is self-limiting. Self-limiting means you don't have to give any particular drug. ये अपने आप ठीक हो जाती. It is self-limiting. Okay, moving to Alport syndrome. Alport syndrome, understand, this is an X-linked recessive होता है और X-linked dominant. It is X-linked dominant condition. So understand, patient will have a triad like there is anterior lenticonus, X-linked dominant. So understand this thing. This is due to mutation of a gene COL4A5. COL4A5 means collagen 4A5 subunit. Now understand, basically you will find the basement membrane defect. So anterior lenticonus, then you can notice patient will have SNHL. तो कान का involvement हो रहा है, आँख का involvement हो रहा है, and you can notice kidney involvement. So this is kidney involvement. You will find glomerulonephritis. So this is the triad of Alport syndrome. Treatment is supportive. Treatment will be supportive, so you don't have to give any particular drug here. Genetic disease से ज़्यादा आप कुछ कर नहीं सकते हो. You can't do much. Moving to IgA nephropathy. IgA nephropathy, we also call this Berger disease. IgA nephropathy, also called as Berger disease. Now understand, if you talk about IgA nephropathy, in IgA nephropathy you will find IgA deposits. So this IgA will be depositing in mesenterium, and this is, I can say, most common cause of nephritic syndrome. It is most common cause of nephritic syndrome. In, I can say, it is affecting children in developed countries. In developing countries, PSGN is more common. In developing countries, if you ask me, in developing countries, PSGN is more common. Right. Now coming to this, okay, Apeksha, NEET PG exam is on 3rd August. So in July, I'll take session of NEET PG as well. So most common cause of nephrotic syndrome, like this IgA nephropathy, it can be seen mainly in children. Now try to understand this thing. When we talk about IgA, you can notice IgA is depositing in mesenterium. This disease is associated with a vasculitis, and this vasculitis is called HSP. HSP means Henoch-Schönlein purpura. So how you are going to manage? So in treatment, we can use steroid, right? If there is no improvement, if you want to control BP, then we can use ACE inhibitor. Now these antibodies, these are triggered from tonsils. So remember, there is some role of tonsillectomy in these patients. So we can also do tonsillectomy. Even remember, fish oil का भी role है यहाँ पर, cod liver oil, fish oil. Done. Good pasture. So G4, good means गुर्दे. गुर्दे को क्या बोलते हैं? What is गुर्दे? गुर्दे means kidney. So this is a disease that's affecting kidney. P4, फेफड़े. फेफड़े means lungs. So this disease will affect your kidney and lungs. So patient, I told you how you will differentiate this from Wegener's. The closest differential will be Wegener's. Wegener's में क्या होता है? Upper respiratory tract भी involved होता है. In Wegener's you will see upper respiratory tract is also involved. So this is about your good pasture, and an antibody that we find here will be anti-GBM. Anti-GBM means anti-glomerular basement membrane antibody. Okay, now understand, MPGN is a condition. It will have feature of both nephritic and nephrotic. दोनों के feature होंगे. It will have feature of both nephritic syndrome as well as nephrotic syndrome. So how we can differentiate this MPGN? Now try to understand this thing. In MPGN, we have two subtype of MPGN. Like I can say, we have a subtype that is called type 1, where you can see dense deposit. So एक type में तो आप deposits कई सारे देखोगे. And second type will have heavy proteinuria. So understand, dense deposit means more feature of a nephritic. Proteinuria means more feature of nephrotic. So but in exam what they ask you, जब आप biopsy करोगे, whenever you will do biopsy, in biopsy you will find tram track appearance. In biopsy you will find tram track appearance. And remember, these like MPGN and MGN, both are something which are associated with infection. So there is a classical association with autoimmune diseases, some chronic inflammation like hepatitis C. Moving to SLE nephritis. SLE nephritis, we also call this lupus nephritis. So lupus nephritis के कई सारे types होते हैं, like we have type 1, 2, 3, 4, 5, 6. So most common type which is diagnosed is type 4. And this type 4 is called as DPGN. DPGN means diffuse proliferative glomerulonephritis. So classical feature of DPGN which you will see is like patient will have, in biopsy you will find wire loop lesion. और यहाँ पर सब कुछ जमा होगा, everything will deposit. So you can see everything will deposit here. So when everything will deposit, what do we call this? We call this ABCD. ABCD means anybody can dance नहीं है, anybody can deposit. Anybody can deposit means we call this full house effect. We call this as full house effect, or you can say houseful effect, full house effect. Now diabetic nephropathy we have discussed already in diabetes. So just मैं आपको बता दे रहा हूँ एक बार. I told you like initial, मैंने आपको stages बताई थी. I told you hyperfiltration in previous video. So then understand, remember they ask you initial sign, or I can say first sign. first sign will be microalbuminuria. And whenever we see this microalbuminuria, then what we should start, you should always start a low dose oral ACE inhibitor. So ACE inhibitors are the drugs which can prevent microalbuminuria. This is one of the first sign of diabetes nephropathy. Lastly, I can say RPGN. RPGN is a type. Actually, it's a complication form. It's a complication or complicated form. So it is a complication of all nephritic syndrome. So all nephritic can convert into RPGN, and the hallmark feature which you will see here will be crescents. So we also call this as crescentic glomerulonephritis. Crescentic glomerulonephritis. Now what are these crescents? Understand, these are like a half moon shaped collection of cells in Bowman spaces. These are made up of epithelial cells and macrophages. So RPGN is a complication. So but understand what they ask you. They ask you this is most dangerous type, and this will have worst prognosis. Means in 1 to 2 weeks patient will have total kidney failure. So this will have worst prognosis. So these are the MCQs which you have to remember on RPGN. Okay, low complement you will see in PSG and MPGN and infective endocarditis. These are the vasculitis. So they ask you all except questions. So hypocomplementemia you will see in all except. This type of question they ask in exam. Okay, now let's talk about AKI. AKI means acute kidney injury. अब इसको समझो एक बार. Like this is like a table from Harrison. You can see this table in Harrison also. तो यहाँ से कई सारे क्वेश्चन एग्जाम में आते हैं. सो अंडरस्टैंड दिस थिंग. AKI वॉज प्रीवियसली कॉल्ड एज ARF, लेकिन अभी इसको ARF नहीं बोलते हैं, बिकॉज दिस एक्यूट किडनी इंजरी इज समथिंग विच इज़ रिवर्सिबल. ये ठीक हो जाती है. सिंस इट इज़ रिवर्सिबल, सो वी डोंट कॉल दिस. सो दिस कैन अकर बिकॉज ऑफ मैनी रीजन. सो वॉट आर द इंपॉर्टेंट कॉजेज विच यू हैव टू रिमेंबर? सो रिमेंबर कॉजेज वी कैन डिवाइड इंटू 3 सब टाइप्स: बिफोर द किडनी, in kidney, after the kidney, pre-renal, intra-renal or intrinsic, or post-renal. Post-renal means any problem in the bladder or after kidney, bladder, prostate की problem की वजह से हो रही है post-renal. Now kidney problem means it can occur in the glomerulus, it can occur in the tubules, it can occur due to kidney vessels. तो kidney में vessels में means renovascular hypertension, renal artery stenosis, TTP, HUS. Tubules problem means any drug or any toxin which is producing toxicity to the tubules. Or I can say problem in the glomerulus like glomerulonephritis. Pre-renal means before the kidney, means suppose body में hypovolemia हो गया, shock हो गया, sepsis हो गई, heart failure, liver failure. So these are all examples. So congestive heart failure. So liver failure can cause kidney disease. इसको बोलते हैं HRS. We also call this HRS, hepatorenal syndrome. We call this HRS or hepatorenal syndrome. So understand this thing. Let us study the post-renal here. So you can see post-renal means any problem where in bladder, ureter, in urethra, in prostate. For example, you can say BPH can cause this, prostate cancer can cause this, any stricture can cause this, Foley catheter can cause this, right? Any obstruction in that Foley catheter. So these are the causes. Now they ask you question in exam like how we define this AKI. Now see, patient was normal. All of a sudden what is happening? You can see creatinine start increasing. So this is the definition, like how we define this. So they ask you a question, what are the stages which we see and what are the important causes. तो मैं यहाँ पर आपको कुछ काम के cause बताना चाह रहा हूँ. The first important cause which I am writing here is, so this is written here but I am just elaborating the main one. Remember, any snake bite. तो याद रखना, snake bite और बिच्छू काट गया, scorpion sting can cause AKI. Second important cause, remember, multiple myeloma से भी हो सकता है. Multiple myeloma can cause. Crush injury, rhabdomyolysis can cause this. Rhabdomyolysis can cause this. So rhabdomyolysis can also cause this. Then remember, what are other important cause? What are other significant cause? So remember, painkillers जो हम routinely use करते हैं. So NSAIDs. These painkillers can cause this. Even like I can say some toxins which are like some antibiotics which can act as toxins like amphotericin B, antifungal basically. Then I can say tetracycline. These in heavy doses can cause some PPI can also cause. Then very important, NSAIDs and I can say other drugs. एक चाइनीज़ हर्बल मेडिकेशन होती है, उससे क्या होता है, कौन बताएगा मुझे? डॉक्टर अपेक्षा, अहमद वाले शेख, 0x रोहित, ट्राई टू आंसर. Chinese herbal medication. It is called aristocolic acid. Aristocolic acid can cause AKI. इसको बोलते हैं Balkan nephropathy. We call this as Balkan nephropathy. So these are some of the causes of AKI which you have to remember. Right? Now remember this AKI can also occur after contrast. So ये भी important है. Any contrast can cause AKI. So they ask you which drug will prevent contrast induced AKI. Just I want to convey two things here. देखो डायबिटीज़ को कंट्रास्ट इंजरी के चांस ज़्यादा होते हैं, ये भी क्वेश्चन आ चुका है. डायबिटीज़ पेशेंट दे विल हैव मोर चांस एंड विच ड्रग विल प्रिवेंट? इट इज N-acetylcysteine. N-acetylcysteine इज द ड्रग विच विल प्रिवेंट कंट्रास्ट इंड्यूस्ड नेफ्रोपैथी. सो AKI को आपको CKD से डिफ्रेंशिएट करना है. सो हाउ वी कैन डिफ्रेंशिएट AKI फ्रॉम CKD? नाउ सी, जस्ट ट्राई टू अंडरस्टैंड. अगर मैं आपको बोलूँ दिस इज आई एम ऑन वन साइड आई एम राइटिंग AKI and second side I am writing CKD. देखो in both the cases you will see patient is having kidney damage. अगर आप KFT की रिपोर्ट देखोगे, if you see the KFT report, तो KFT की रिपोर्ट में तो दोनों का यूरिया क्रिएटिनिन बढ़ा हुआ दिखेगा. Then how we can differentiate? So first try to understand this thing. AKI was previously called ARF. CKD is still called CRF. लेकिन AKI को अब ARF नहीं बोलते, तो मैं इसको काट दे रहा हूँ. So why we don't call this ARF? Because AKI is reversible. जब reversible है तो failure नहीं बोलोगे इसको. CKD is still called CRF because this is irreversible and progressive. Irreversible and progressive. तो here यहाँ पर तो ये progress करते चले जाएगा. Right? Now try to understand when we talk about AKI and CKD. Understand this thing. अगर मैं बात करूँ AKI और CKD की, how else we can differentiate? So understand this thing. अगर पेशेंट को AKI होगा, then remember kidney size is mostly normal. Kidney size will be normal. If it is CKD, then you can see size will shrink. So here you will see a shrunken kidney, a shrunken fibrotic kidney. कुछ पेशेंट में साइज श्रंक नहीं करता, लाइक इन पेशेंट ऑफ डायबिटीज, इन पेशेंट ऑफ एमिलोडोसिस, इन PCKD पेशेंट. तो देन हाउ वी कैन डिफरेंशिएट? वी कैन डिफरेंशिएट बेस्ड ऑन corticomedullary junction. Corticomedullary junction, this is normally clearly visible in AKI. This corticomedullary junction, this will disappear or it is lost in CKD. Clear? Any doubt guys? Now understand this thing. चारों बला I'm telling you same thing. Symptom से आप differentiate नहीं कर सकते. Right? There are two symptoms where we can differentiate. Now come on, tell me, what are these two symptoms? देखो बाकी सारे symptoms same होते हैं. Just two symptoms where we can differentiate. Come on, try करो, कोशिश करो. What are two symptoms where we can differentiate AKI के CKD? देखो साइज करने के लिए आपको क्या करना है? साइज देखने के लिए you just need an ultrasound. So with ultrasound you cannot differentiate. You can differentiate, but in some patient you can't differentiate. Then how we can differentiate? Two symptoms. So remember these are two symptoms. Which symptoms? Bone problem, bone fracture, dislocation, low bone density, low bone mineralization, osteitis, fibrosica, cystica, then secondary hyperparathyroidism means इसको बोलते हैं mineral bone disease MBD, and neuropathies. So bone problem and neuro problem means neuropathies. These are absent here. These are present in CKD. Vomiting fever सब में होगा. Vomiting fever you can see in both, right? So CKD will also have opportunistic infection, so we cannot differentiate. Remember these are the difference between AKI and CKD. Now try to understand. In CKD this is again reference for medicine. Most common cause, अगर आप चाहोगे, if you go to any dialysis center, suppose वहाँ पर 10 patient admission, you will see 10 के 10 को क्या होता है? Diabetes. So most common cause of CKD will be diabetes. Then it can occur because of glomerulonephritis due to hypertension also. It can occur because of PCKD. It can occur because of other diseases. But most common cause, अगर आप देखोगे 10 में से 9 या कभी कभी 10 के 10 पेशेंट कैसे होंगे? डायबिटीज़ होंगे. वेरी वेरी कॉमन. नाउ अंडरस्टैंड इन AKI what parameters we check. अब देखो समझो इसको और समझते हैं थोड़ा सा. इन AKI what we check in patient. Suppose आपके पास एक पेशेंट है, right now is having kidney damage, and this kidney damage happened in this patient because he had some sepsis, but there is a possibility he will improve. तो हम पेशेंट का बार बार क्या चेक करते हैं? सो वी विल चेक पेशेंट सीरम क्रिएटिनिन एंड वी नीड टू चेक पेशेंट यूरिन आउटपुट. Suppose after 2-3 days creatinine start decreasing and patient यूरिन आउटपुट start improving, अगर पेशेंट का क्रेटिनिन कम होना स्टार्ट हो गया, यूरिन आउटपुट बढ़ने लगा, इसका मतलब ये पेशेंट जल्दी ठीक हो जाएगा. बट इन CKD what parameter we check? In CKD the parameter which we decide prognosis will be estimated GFR and albuminuria. So parameters which are important in AKI will be creatinine and urine output. Parameters which are important here will be eGFR and albumin. So understand this thing. अब AKI को देखो. For AKI what else we have? In acute kidney injury we have different like classification. We, for example, like we have rifle criteria. Then what we have Crigo nowadays we use. तो अगर आप देखोगे दिस इज CKD का GFR के बेस पे, और वी कैन क्लासिफाई बेस्ड ऑन albuminuria. So for us important will be based on GFR. Suppose this is like based on GFR which you have to remember. So I'm writing this again. So GFR, based on GFR, suppose if GFR this is less than 15, so I can say it is less than 15, or it is 15 to 30, or it is 30 to 60, or it is 60 to 90, or it is more than 90. So understand this thing, these are called grade. So based on this we can classify grade. This is called grade 1. This is called उल्टा चलेंगे. Grade is called grade 1, grade 2, grade 3, grade 4, grade 5. So grade 5 CKD कब बोलोगे? When GFR is less than 15. So now understand we have G1, G2, G3. In G1, G2, G3, so treatment will be supportive. So what we do? We do supportive treatment. In G4, G5, the treatment will be either take the patient to dialysis department, do dialysis, or what we can offer transplant. या फिर transplant कर दो. We will do dialysis or transplant, right? So this is about the CKD classification which you have to remember. Now one by one we'll talk about dialysis. So कैसे आपको dialysis करना है? So what are the topics? What are the things that they ask on dialysis? So understand there are few MCQs which they ask on dialysis. So dialysis, understand, before dialysis we make fistula. So fistula is a common method of doing dialysis. So understand the purpose of making fistula will be this will connect artery and vein. So what we call this? We call this arterialization of vein. Arterialization of vein. So आपको पहले पेशेंट को फिस्टुला बनाओगे. So फिस्टुला से क्या होगा? आर्टरी वेन मिल जाएंगे. Now they ask you dialysis recommendation. So what is the dialysis recommendation? So recommendation means how you recommend dialysis. तो हफ्ते में कितनी बार होना चाहिए? Supportive treatment means understand symptomatic treatment. Symptomatic means आपको पेशेंट का A1C कंट्रोल करना है. A1C means HbA1c. You need to control sugar. आपको पेशेंट का BP कंट्रोल करना है. Then understand we need to control, like is this you can remember, A1C means HbA1c, sugar control करना है by giving insulin or by giving OHA. So target HbA1c will be less than 7. B means BP control, patient का BP 130/80 से कम होना चाहिए. Then we should control patient cholesterol. Then we should supplement patient vitamin D. We should give erythropoietin, and we have to control potassium. Potassium उसका control. So this is ABCDEK. A1C supportive means sugar control, A1C control. B is BP control. C is cholesterol control, means target triglycerides should be less than 150. D means we should supplement patient vitamin D. E means आपको पेशेंट को erythropoietin देना है बिकॉज अनीमिया करेक्ट करना है. CKD पेशेंट के अंदर नॉर्मोसाइटिक अनीमिया होता है. एंड K is कालेमिया करेक्शन. कालेमिया मीन्स पोटेशियम करेक्शन. वी नीड टू करेक्ट द पोटेशियम. सो CKD पेशेंट मोस्टली दे विल हैव हाइपरकैलेमिया, तो आपको उस हाइपरकैलेमिया को ठीक करना है. चारू बोला क्लियर? दिस इज सिम्टोमैटिक ट्रीटमेंट. ओके, नाउ कमिंग टू रिकमेंडेशन मीन्स आप कितना रिकमेंड करते हो डायलिसिस? इट इज थ्राइस इन अ वीक. सो अंडरस्टैंड दिस थिंग. दे आस्क यू व्हाट इज द फ्लो रेट. डायलिसिस में फ्लो रेट क्या होती है? सो व्हाट इज द फ्लो रेट? सो फ्लो रेट अंडरस्टैंड इट इज 300 to 500. It is 300 to 500 ml per minute. Right, now understand they ask you like what are the session duration. So duration means एक dialysis on an average it goes up to 4 hours. फर्स्ट सेशन जो पहला सेशन होता है वो छोटा होता है. फर्स्ट सेशन इज ऑफ 2 hours. राइट, फर्स्ट सेशन विल बी 2 hours. Now they ask you like in dialysis what are the things we use, आप क्या क्या use करते हो. So understand this thing. In dialysis what we use, we have like dialyzer. We have dialyzer. This dialyzer, it is made up of polysulfone. It is made up of polysulfone. Then what we have dialysate. Dialysate. This dialysate is made up of bicarbonate buffer. Bicarbonate buffer. Then understand we will also use heparin. Heparin is anticoagulant. It will prevent clotting. इसलिए हम heparin भी use करते हैं. Now try to understand. Just remember heparin. This should be stopped 1 hour before completion. Suppose 4 घंटे का सेशन तो तीसरे घंटे के बाद बंद कर दो. Heparin should be stopped 1 hour before completion. It should be stopped 1 hour before completion. Now they ask you what are most common complication. So most common complication of dialysis. Most common complication will be hypotension. And most dangerous complication will be patient can develop dialysis disequilibrium syndrome. Dialysis disequilibrium syndrome. This is like patient can develop sometime. इसमें क्या होता है, patient को cerebral edema हो जाता है. So patient can develop cerebral edema. So we call this dialysis disequilibrium syndrome. Okay, now coming to pyelonephritis. Pyelonephritis means you can see purulent inflammation. So just remember, we can have acute pyelonephritis, we can have chronic. So chronic will have more changes. So chronic will have more changes in the kidney, and acute will have more symptom. Acute में patient को symptom ज़्यादा होंगे. In chronic you will see more changes. So it is basically an ascending infection. So patient को UTI होगा. Untreated UTI can cause cystitis, and untreated cystitis can cause pyelonephritis. And remember, in all these three conditions, we can use antibiotics like we can use fluoroquinolone, or we can use nitrofurantoin. और अगर इससे भी improvement नहीं आ रहा, then we can use fosfomycin. Now understand, if you ask me cause, so तीनों का most common cause will be E. coli. Second, you can see like in some places it is Proteus, in some places it is Klebsiella. So all these are like bacteria where fluoroquinolones, nitrofurantoin, they are very effective. Done. Okay, now moving to Bartter syndrome. So Bartter syndrome is autosomal recessive condition. You can see defect in sodium potassium 2 chloride transported, but there is no hypertension in Bartter syndrome. If you compare this Bartter, remember Bartter and Gittleman syndrome, they will not have hypertension, right? So Liddle syndrome is something where you will see hypertension. Now they ask you what are the causes of contracted kidney and what are the causes of diseases where CKD where kidney size increase. So these are the examples of CKD condition where kidney size. So normally CKD में kidney size छोटा होता है, but understand in amyloidosis, in PCKD and diabetes, here kidney size will increase. Contracted kidney, understand asymmetrical contracted kidney, एक तरफ की kidney छोटी, एक तरफ की kidney बड़ी. This is a classical feature of pyelonephritis, chronic pyelonephritis, right? Nephrosclerosis and chronic glomerulonephritis will have symmetrical, but remember asymmetrical is the classical feature of chronic pyelonephritis. So first clinical sign of diabetes, it is microalbuminuria. Most common type of glomerulonephritis will be diffuse glomerulosclerosis, but most specific will be nodular. And these nodules are what we call them. We call them Kimmel-Steele-Wilson nodule. These nodules are called as Kimmel-Steele-Wilson nodule. These are diabetes renal manifestation. Done. So this is about your discussion of nephrology. I hope you enjoyed this. Am I clear? Okay, then take a short break. After this break, we'll discuss. इसके बाद एक neurology और पढ़ लेते हैं. Then you are free to go. Right. So we will resume the session in 10 minutes. Okay guys, so now let's talk about CNS, means थोड़े से बात कर लेते हैं न्यूरोलॉजी की. So firstly they ask you question on GCS. GCS means glass glow comma scales. So from GCS they ask you a lot of question in exam, हर बार एक question आता है. So in GCS understand we will talk about eye component, we will talk about verbal component and we will talk about motor component. So understand minimum score. Minimum score आप सबको एक एक देते हो. So they ask you two question, what is the minimum score? So minimum score means 1 to each, so minimum score will be 3. 1 in each, so 3. And total score or maximum score, it is 15. It is 15. So understand for I we have total 4 points, for verbal 5 and motor 6. Right? So understand this thing. Suppose you are having a patient who is unconscious, brought unconscious, or I can say a patient who is having like stroke or patient with DK. So आपको उसका GCS निकालना है. अब GCS आप कैसे निकालोगे? So understand, suppose you tell the patient open your eyes, he is opening your eyes. So suppose he open eyes spontaneously. Then we give score of 4. Suppose वो आँखें खोल रहा है तेज साउंड पे. If you are shouting at him, then we give score of 3. Suppose when you give pain only then he is opening out, we give score of 2. वो आँखें खोल ही नहीं रहा, he is not opening, then we give score of 1. So I told you minimum will be 1. So spontaneously 4, sound 3, not opening 2, not opening 1, pain 2. So this you can remember by mnemonic ESPN. ESPN. Now let's talk about the verbal component. Verbal component means, understand this thing. Verbal component means patient कैसे बात कर रहा है. So if you talk about verbal component, so let's say when we talk to patient, so understand he is conscious and oriented. So patient is oriented to time, place, person. He is, suppose I can say, little confused. Patient is slightly confused. आपने पूछा like what is the time today, he is not telling 5 o'clock, he is telling you like it is 2 o'clock afternoon. Suppose you ask something, but this patient is having some inappropriate word. Suppose you cannot comprehend, you cannot understand what he is saying. He is having some incomprehensible sound. If patient is having incomprehensible sound, or I can say patient is just moaning and no sound, so oriented to time, place, person, we will give score of 5. Confused, we will give score of 4. Word inappropriate, we will give 3. Incomprehensible sound or patient ऐसे moaning कर रहा है बस 2. No sound, we give score of 1. So this you can remember by mnemonic R country win. R country win. Now moving to motor component. So motor component, understand motor component you can remember in different way. So motor component को आपको कैसे याद रखना है. So suppose if you see patient को आपने बोला left hand ऊपर उठाओ, वो उठा रहा है, so he is obeying your command. So if patient is obeying command, we give a score of 6. यहाँ 6 से start करेंगे. Then understand he is taking you where he is having pain, so he is localizing to pain. So when he is localizing to pain, we give score of 5. He is having a withdrawal reflex to pain, or he is withdrawing to pain. Withdrawal to pain, we give score of 4. Patient is coming, he is sitting with a flexion attitude like this. Patient सिकुड़ के ऐसे बैठा हुआ है. This flexion posture. This flexion is what we call this decorticate posture. Decorticate posture. Then we give score of 3. Then patient is coming to you with abnormal extension. Then we give score of 2. And there is no response. When we see no response, we give score of 1. Abnormal extension को हम बोलते हैं decerebrate. So we have decorticate and we have decerebrate. So understand इसको आप कैसे याद रखोगे? We can remember by mnemonic can't live without fan. So this is, देख लो ध्यान से, right? It is called a decorticate because patient will be lying in bed like this, like ऐसे एकदम fold होके बैठेगा. We call this flexion attitude. Is it clear? Flexion attitude. सिकुड़ के बैठेगा, right? Okay, now coming to this is like अब आपको क्वेश्चन कैसे पूछेंगे? They will add everything and they will ask you like a patient is having patient met a road traffic accident. He came to you with his eyes are opening only to sounds. He is confused and he is localizing to pain. Calculate the GCS. So इस तरीके से आपको एक क्वेश्चन एग्जाम में पूछना है. They will ask you to calculate GCS. Okay, now coming to types of headaches. So they ask you question on different types of headaches. So we can have migraine. So migraine, if you see the headache is unilateral or what we call this hemicrania. हाइपरटेंशन का अगर आप हेडेक देखोगे तो हाइपरटेंशन हेडेक इज ऑक्सीपिटल हेडेक. नाउ कमिंग टू स्ट्रेस हेडेक और व्हाट वी कॉल दिस टेंशन हेडेक. दिस इज लाइक अ हेडेक विच इज हैविंग अ बैंड लाइक सेंसेशन. और ये हेडेक वाइफ से होता है, पूरे सर में हो रहा है. नाउ ट्राई टू अंडरस्टैंड. दे आस्क यू अ क्वेश्चन ऑन डिफरेंट टाइप्स ऑफ हेडेक. सो आजकल क्वेश्चन क्या पूछ रहे हैं? दे आस्क यू क्वेश्चन ऑन सेकेंडरी हेडेक. सो जस्ट आई एम राइटिंग हियर. सो व्हाट आई मीन बाय सेकेंडरी हेडेक. सो दे आस्क यू लाइक विच हेडेक नीड फर्दर इंटरवेंशन. Now see, what are all the primary headache? So primary headache means it is most common will be tension headache. Second most common will be migraine. And third most common will be cluster headache. So in these three headache, understand diagnosis is clinical. Clinical means आपको कोई CT MRI नहीं कराना. So understand this thing further. I can say further step in making diagnosis you will make only in secondary headache. Now there are some headache, for example headache due to NCC, neurocystic sarcoidosis, or I can say headache due to any cyst in the brain, or I can say headache due to some brain tumor, or headache due to any brain abscess, or I can say any headache due to any like metastasis in your brain, or I can say any headache, this type of headache like neurocystic sarcoidosis due to cyst, tumor, abscess, what we call them, इसको हम बोलते हैं anything that is occupying brain in your brain, space occupying lesion. So this can also produce headache. So mostly in exam what they ask you question on migraine. So आपसे exam में question पूछते हैं migraine के. So now try to understand what type of question they ask you in migraine. They ask you question on migraine means how we make a diagnosis of migraine कि migraine है भी या नहीं है. So migraine headache will be unilateral. Then you will notice this headache is pulsatile in nature, means धीरे धीरे बढ़ेगा. It is never mild, it is moderate to severe. So migraine mild नहीं होता, या तो moderate या severe. And this type of headache will aggravate with movement. So once again, headache is unilateral or I can say hemicrania. Then you can notice like this type of headache is pulsatile in nature. This is moderate to severe. It will aggravate with movement. And if you notice like what we call this, it is pulsatile or throbbing type of pain. Then understand this type of headache which we see in migraine. This is associated with nausea or vomiting. It is also associated with photophobia or phonophobia. So understand this thing, इसको समझो ध्यान से. So how we make a diagnosis, आपको diagnose कैसे बनाना है? You need any two feature from this list, any one from this, any one from this. So this is how we make a diagnosis of migraine. 211. Okay, now let's talk about seizures. So what is seizure? Understand, it is a hypersynchronous discharge due to some electrical activity in your brain. आपके ब्रेन में कुछ ना कुछ इलेक्ट्रिकल एक्टिविटी हो रही है, इसकी वजह से डिस्चार्ज हो रहा है. नाउ व्हेन वी टॉक अबाउट सीजर, सो इफ़ आई टॉक अबाउट जस्ट सीजर, तो इसको समझो, सीजर किसी को भी हो सकता है. एपिलेप्सी इज अ डिसीज, सो सीजर इज अ सिम्टम. सो मुझे भी सीजर हो सकता है, आपको भी हो सकता है. सो अंडरस्टैंड सीजर, इफ़ यू टॉक अबाउट लाइक अ पेशेंट हु इज़ यंग, then most common cause of seizure will be RTA. So sometimes you will see RTA means road traffic accident, बाइक से एक्सीडेंट हो गया, कार से एक्सीडेंट हो गया. इफ़ यू सी इन एल्डर पीपल, जैसे जैसे आपकी उम्र बढ़ती है आपकी गाड़ी की स्पीड कम होती है. इन ओल्ड पीपल द कॉज ऑफ सीजर विल बी स्ट्रोक, राइट. ओके, माइग्रेन का ट्रीटमेंट, लेट्स डिस्कस द ट्रीटमेंट ऑफ माइग्रेन. तो माइग्रेन ट्रीटमेंट पढ़ लेते हैं. नाउ अंडरस्टैंड, in treatment of migraine, we need to understand whether it is we need to treat the acute attack of episode or what drug we give for prophylaxis. So treatment of acute attack एंड ट्रीटमेंट इन प्रोफाइलैक्सिस मीन्स PX. अब इसको समझो. अब अटैक में आपको क्या देना है, प्रोफाइलैक्सिस में क्या देना है, तो उसको समझो. इन अटैक व्हाट वी हैव द मेन ड्रग विल बी द प्रॉब्लम इज पेन. तो आपको पेशेंट को पेन किलर देना है. सो इन अटैक व्हाट वी गिव एनसेड्स एंड मोस्ट प्रिफर्ड एनसेड इज नेप्रोक्सिन. सर दर्द के लिए सबसे प्रेफर क्या करते हैं, नेप्रोक्सिन. सो नेक्स्ट डोम आपने देखा होगा, एक टैबलेट आती है नेक्स्ट डोम मीन्स नेप्रोक्सिन, और साथ में उसमें क्या होता है, डोमपेरिडोन मीन्स एंटीमेटिक. NSAID से improvement नहीं हो रहा, then we give triptans. So you can see a tablet of Behçet, triptan, sumatriptan. Then we can use some old drug. कभी कभी पुरानी दवाइयाँ होती हैं, अर्गोटामिन आजकल उतना यूज़ नहीं करते. We can use अर्गोटामिन, we can use caffeine tablet, right? And we have a new drug called lecimeditan. So these are the drugs we have for acute attack. Now coming to prophylaxis. For prophylaxis, what we use? We use non-selective beta blocker. Non-selective beta blocker like propranolol. Agar sometimes suppose if there is no improvement coming from propranolol, then we can add TCA. TCA means tricyclic antidepressant. Then we can also use topiramate. Topiramate basically एक anti-epileptic drug है. We can use this. We can use carbamazepine. Right? And we can also use some CCBs. some SSRIs. So these are the drugs that we offer in prophylaxis. So practice में generally हम क्या देते हैं, we use NSAID, propranolol, triptans and TCA. ये चार चीज़ें आपको याद रखनी है, right? थोड़े old physician जो होते हैं, they also use a tablet of ergotamine, एक Sjögren नाम से tablet आती थी. Now coming to new drugs. So what are the new possible option? So what are the new? So understand this thing. In migraine, the main hypothesis is CGRP. So we will use CGRP antagonist. CGRP मीन्स कैल्सिटोनिन जीन रिलेटेड पेप्टाइड. तो या तो आप ऐसी दवाई दे दो, द ड्रग्स विच विल एक्ट अगेंस्ट CGRP, और वी कैन यूज मोनोक्लोनल एंटीबॉडीज अगेंस्ट CGRP. सो व्हाट आर द मोनोक्लोनल एंटीबॉडीज अगेंस्ट CGRP? सो अंडरस्टैंड दिस थिंग. CGRP एंटागोनिस्ट यू कैन रिमेंबर, इनके एंड में जीपेंट होगा. सो दे विल एंड इन जीपेंट. उबरोजीपेंट, रेमीजीपेंट, दीज आर जीपेंट. एंड द एंटीबॉडी दैट वी हैव इज कॉल्ड एर्नुमुमैब. Galcanezumab. Even now understand, we have like एक toxin होता है. Just remember, these are something new. Onabotulinum toxin. Onabotulinum toxin is also approved in migraine. Onabotulinum toxin type A. This is something which is approved in treating migraine. So this is like, these are some new remedies. Clear? Charubala, am I clear? So this is about the migraine treatment part which they ask in exam. Now अगर मैं बात करूँ epilepsy की, so we can have focal epilepsy, we can have like generalized epilepsy. So how we can differentiate these two types of epilepsy? Understand this thing. So focal epilepsy will have certain types. So focal को हम partial भी बोलते हैं. So we can also call this as simple partial seizures, and we can call complex partial seizures. Simplex partial or complex partial seizure. So understand, focal seizure we also call the simple partial, complex partial. In simple partial seizure, what we have? Understand this thing. In simple partial seizure, we have I can say diseases like, we can have Jacksonian march. Jacksonian march means seizure will move. Seizure march कर रहा है, move कर रहा है. Means patient को start हुआ यहाँ से, suppose from here, it is moving from distal to proximal. Means ऐसे यहाँ से start हुआ, then it is moving here from distal to proximal. Second type means after seizure, all of a sudden इतनी कमजोरी हो गई. After seizure, patient is having extreme weakness, जैसे कि patient को फालिश पड़ गई होगी, लकवा मार गया हो. So seizure followed by, patient is having seizure, and this is seizure is followed by extreme weakness. एकदम से बॉडी में कमजोरी आ गई. We call this Stot's palsy. Now complex partial seizure, here we have a term, we call this mesial temporal lobe epilepsy. Mesial temporal lobe epilepsy. Now see here, you will see temporal lobe involvement is there. So temporal lobe का involvement है. Why? Because patient is having sclerosis in the hippocampus. So there is hippocampal sclerosis, and because of this patient will have hallucination. So पहले patient को hallucination होगा. So this is what we see there in complex partial seizure. Then आप इसको समझो, like in mesial temporal epilepsy there is no effective drug. इसमें कोई drug काम ही नहीं करेगा. So patient को seizures कैसे होंगे? You will see patient will have refractory seizure. Refractory seizure means so we have to do a surgery. So आपको क्या करनी पड़ेगी? Neurosurgery, and that neurosurgery is called as hippocampectomy. Hippocampectomy, or we can do corpus callosotomy, right? Now sometime what they ask you in exam, they ask you कि patient को seizures का differential diagnosis will be syncope. So कैसे आप differentiate करोगे? Now understand. Onset in day and gradual. Day means generally where in afternoon, दोपहर में हो रहा है और धीरे धीरे हो रहा है. Upright means patient जब खड़ा हो रहा है तब हो रहा है. Dizziness, lightheadedness, blurring is seen. Lip में pallor है. Sweating is common. Close duration is less than 15 seconds. EEG is normal and loss of consciousness per second. So understand this thing. These are the points which I just told you. This is called what we call, क्या बोलते हैं इसको? We call this syncope. तो सीजर में क्या होगा? अंडरस्टैंड दिस थिंग. इफ यू आस्क मी टू राइट द डिफरेंशियल डायग्नोसिस, कैसे से आप इसको डिफरेंशिएट करोगे? सो ऑनसेट विल बी एनी टाइम. सीजर किसी भी टाइम हो सकता है. पोजीशन विल बी एनी पोजीशन. एनी पोजीशन. दिस डिजीनेस, लाइट हेडेडनेस, ब्लरिंग, दीज आर एब्सेंट. लिप पैलर की जगह यू विल सी पेरी ओरल साइनोसिस. होठ के पास ब्लूइश डिस्कलरेशन होगा, साइनोसिस. डायफोरेसिस इज नॉट सीन. क्लोनस ड्यूरेशन विल बी मोर देन, क्लोनस ड्यूरेशन मीन्स जो झटके आते हैं सीजर में, जस्ट जर्क्स विल बी मोर देन 15 सेकेंड. ईजी विल बी एबनॉर्मल. और लॉस ऑफ कॉन्शियसनेस यहाँ सेकेंड्स में नहीं होगी, हियर इट विल बी 4 मिनट्स. मीन्स हो सकता है पेशेंट 2 मिनट, 5 मिनट, समाइम 1 hour he will become unconscious. So this is what we call this seizure. So remember, this is how we can differentiate seizure from syncope, right? Yes, we can also do like इसमें surgery means आपको basically hippocampus को ठीक करना है. So we can do corpus callosotomy, we can do hippocampectomy, we can do amygdalectomy. Sometimes we can remove entire lobe. कभी कभी पूरी लोब भी निकाल देते हैं, उसको बोलते हैं temporal lobectomy. Done? Am I clear? Happy baseball equipment is clear. Sometimes we have to do entire lobe removal. Okay, now look at this seizure. This is called absence seizures, right? अब इसको देखो. For focal seizures, the treatment for focal seizure, the best drug what we have is we have carbamazepine. Even nowadays इससे बेटर आता है ऑक्सीटॉल नाम से एक टैबलेट आती है, ऑक्स कार्बामाजेपिन, right? Now coming to syncope. In syncope you have to do symptomatic management, means we need to find the cause and treat it. Means आप पेशेंट को पानी पिलाओ, हाइड्रेट करो, right? Maybe syncope is occurring due to hyponatremia, correct the sodium. Due to water deprivation, then give water. Sometime even hypoglycemia, शुगर कम होने से भी syncope आ जाता है, so that we need to treat that. Simple. Done? Okay, now coming to this type of seizures, we call this absence seizures. Absence seizure means patient की क्या हिस्ट्री होगी? They will tell you like patient having vacant staring spells. Vacant staring spell means एकदम से थोड़े टाइम के लिए blackout spells आ गए. IQ is normal, but still these child will be having low marks in class. There will be low marks in class because थोड़े टाइम के लिए गायब हो जा रहा है, right? Then try to understand these patient. If you notice these patient will have like 2 to 4 hertz spike and dome pattern. In EEG you will find 2 to 4 such spike and dome pattern. And in treatment what we give, क्या देंगे treatment में? Anyone? We give ethosuximide. अगर ये ऑप्शन में नहीं है, then we can choose valproate. So this is about your absence seizures. Absence seizure is also called as petit mal epilepsy or absence seizures. Okay, now understand we have status epilepticus and levetiracetam. So I want to convey something about two drugs. मैं आपको दो दवाई के बारे में बताना चाहता हूँ. This levetiracetam and one more drug that is called lamotrigine. So levetiracetam is a drug which is like a new drug in epilepsy, and this drug is something which is having minimal side effect. You can notice patient के बिल्कुल ना के बराबर side effect है, and very effective drug, very effective. Now coming to lamotrigine, understand this is a drug. It's also very effective, and this is considered first line in all type of epilepsy. ये लास्ट ईयर नीट पीजी का क्वेश्चन था, एक हारिसन की टेबल से क्वेश्चन पूछा था. सो दिस इज लाइक इन एवरी टाइप ऑफ एपिलेप्सी इट इज कंसिडर्ड फर्स्ट लाइन, बट रिमेंबर ओनली इन फ्यू पेशेंट इट कैन प्रोड्यूस अ साइड इफेक्ट. कुछ लोगों को क्या होता है, इट कैन कॉज अ रैश, वी कॉल इट स्टीवन जॉनसन सिंड्रोम. सो सेफ्टी वाइज द बेस्ट ड्रग विल बी लेवेटिराcetam. इट इज अ गेम चेंजर इन एपिलेप्सी. It is a game changer. Now understand what else they ask you in exam. They ask you question like from seizure topic they ask you question based on drug. तो एक क्वेश्चन पूछते हैं when to stop anti-epileptic drug. When to stop anti-epileptic drug. तो आप anti-epileptic drug को कब बंद करोगे? Suppose there is no seizure in last 2 years. अगर पिछले 2 साल से कोई सीजर नहीं आया, then what we do, taper the dose and stop. पहले आप डोज को कम करोगे तब बंद करोगे. डू नॉट स्टॉप दिस एंटीएपिलेप्टिक ड्रग ऑल ऑफ अ सडन. पहले डोज को टैपर करो फिर बंद करो. डन. ओके, नाउ लेट्स टॉक अबाउट अनदर डिसीज कॉल्ड जीबीएस. जीबीएस मीन्स गिलियन बारे सिंड्रोम. अब इसको समझो थोड़ा सा, जस्ट अंडरस्टैंड दिस थिंग. इन जीबीएस व्हाट दे आस्क यू, वी हैव 2 फॉर्म. So first is we have an acute form disease, and we have chronic form of disease. Generally the time duration is close to 8 weeks. So in acute we have total 4 conditions. Most common will be AIDP, acute inflammatory demyelinating polyneuropathy. Second will be Aman, acute motor axonal neuropathy. Third will be AMSAN, acute motor sensory axonal neuropathy. And fourth is called Miller-Fisher syndrome. In chronic we have only one variant, that variant is called CIDP. अब इसको समझो. सो जो इधर यहाँ पर लिखा हुआ, दिस इज द टेबल. लाइक हियर वी कैन सी AIDP, दिस इज मोस्ट कॉमन acute type. Then we have Aman, this is AMSAN, and we have Miller-Fisher. Now understand this thing. They ask you question on management. So understand, in all acute type how you will treat. In acute we will give IVIG. In chronic type what we give steroid. Now what type of question they ask you in exam, understand this thing. They ask you like these types will have some antibodies. So just understand this thing. In AIDP, which is most common type, you will see antibody. This antibody is called as anti-GM1. In Aman you will see an antibody. This antibody is called as anti-GD1A. And the same antibody you will see here also. In Aman and AMSAN you will see GD1A. In Miller-Fisher, this is like a rare type. Here you will see antibody called anti-GQ1B. So in Miller-Fisher, understand there is a triad. This triad you can remember by mnemonic AO. AO means patient को क्या होगा, ataxia, ophthalmoplegia, ataxia, areflexia, ophthalmoplegia. Ataxia, areflexia, ophthalmoplegia. So this is like a triad of Miller-Fisher syndrome. What type of question they will ask you in exam? They will start the question like this, like a 30-year-old person had gastroenteritis. So what is in the history? There is history of GI infection or respiratory infection. तो पेशेंट को 3-4 हफ्ते पहले अगर होगा तो एक्यूट फॉर्म, अगर 8 हफ्ते से ज़्यादा हो गए क्रॉनिक फॉर्म. So generally understand this thing in USA like burger, these are very common. Hamburger, hot dog is very common. So GI infection किससे होता है? You will see Campylobacter. So most common will be Campylobacter. इंडिया में क्या होता है? छोले कुलचे, छोले भटूरे, समोसे, कचौड़ी, street food. So this can also occur because of Shigella salmonella infection. It can also occur after mycoplasma infection, and remember it can also occur after infection with COVID-19. So for exam purpose, what you have to remember Campylobacter jejuni. So understand this thing, patient had Campylobacter infection. Few weeks later he developed ascending. So few weeks later what you can see, कुछ हफ्ते में क्या हो गया? Ascending neuropathy. Ascending means स्टार्ट पैरा से हो रही है और ऊपर की तरफ बढ़ रही है, राइट. तो दिस इज अबाउट योर GBS. एंड इन एक्यूट केसेस व्हाट वी गिव IVIG. इन chronic we give steroid. Okay, now we have a topic we call this MS. MS means multiple sclerosis. So MS is multiple sclerosis. So they ask you straightforward question in exam from MS. It is most common demyelinating CNS disease. Then in MS what they ask you like what are the most common symptoms. So most common symptom will be sensory symptom. Then some patient will develop motor symptom, and some patient will develop optic neuritis. What else is important, or क्या important होगा? Understand this thing. When you see a patient of multiple sclerosis, there are two symptoms which we will not see in every patient, but they are very specific. जब आप पेशेंट की मुंडी नीचे करोगे, व्हेन यू फ्लेक्स द पेशेंट नेक, नाउ सी व्हेन यू फ्लेक्स द पेशेंट नेक ही विल से आई एम हैविंग इलेक्ट्रिक करंट लाइक सेंसेशन. पेशेंट बोलेगा मुझे करंट लग रहा है, झटका लग रहा है. दिस इज व्हाट वी कॉल दिस लरमिट्टे साइन. तो व्हाट इज लरमिट्टे साइन? लरमिट्टे साइन मीन्स फॉर्मेशन ऑफ इलेक्ट्रिक करंट और इलेक्ट्रिक शॉक लाइक सेंसेशन ऑन फ्लेक्शन ऑफ नेक. जैसे ही पेशेंट गर्दन फ्लेक्स कर रहा है. Then understand this thing, patient when you take the patient to kitchen or in hot summers of India, जो patient धूप में जाएगा या गर्मी में जाएगा, इसके symptom बढ़ जाएंगे. So we call this worsening of symptom on exposure to heat. We call this Uthap's phenomena. Uthap's phenomena means worsening of symptom on exposure to heat. We call this Uthap's phenomena. Then understand here basically what you have to remember antibodies होगी, it's an autoimmune condition. So these antibodies, understand these antibodies, they will mainly target myelin basic protein. So what we call these antibodies? We call them antibodies. These are against or anti oligodendrocyte glycoprotein. Oligodendrocyte glycoprotein. Now try to understand what else they can ask you. Like in MS you will notice there is involvement of nerve. अब कौन सी nerve affect होते हैं? So you can see there is involvement of facial nerve. The patient can have involvement of facial nerve. Any other canal nerve you can say there is involvement of trigeminal nerve. तो facial nerve का involve होगा, patient can develop facial nerve palsy. There is involvement of trigeminal nerve. Then you can also see there is involvement of glossopharyngeal nerve. So these are three canal nerves which are affected. Very very important. And lastly I can say like in MS we have different type. So most common type and most dangerous type. The most common type is called relapsing remitting type. Relapsing remitting type. This is most common type. And most dangerous type will be primary progressive type. This is considered most dangerous type. So these are the MCQs. And lastly I can say in treatment what we give steroid. ट्रीटमेंट में आपको क्या देना है? स्टेरॉइड. एक क्राइटेरिया होता है इसके डायग्नोस्टिक क्राइटेरिया का. सो डायग्नोस करने के लिए यू विल डू लाइक क्लिनिकल सिम्टम प्लस वी विल नीड CSF फाइंडिंग. सो डायग्नोस करने के लिए वी नीड क्लिनिकल डायग्नोसिस मीन्स क्लिनिकल सिम्टम प्लस यू विल डू MRI प्लस व्हाट वी नीड CSF. सो इन MRI व्हाट यू विल फाइंड पैची एरिया. कई जगह आपको माइलिनेशन गायब हो जाएगा, माइलिन शीट विल बी गॉन, राइट. चीफ कंप्लेंट विल बी सेंसरी सिम्टम. सेंसरी सिम्टम मीन्स अंडरस्टैंड सपोज नॉर्मली अगर मैं आपको इफ़ आई टच यू विथ सपोज हॉट कप ऑफ मिल्क, यू विल रिमूव योर हैंड। तो यहाँ पर पेशेंट को सेंसेशन ऊपर नीचे हो जाएंगे, समवेयर you will feel more senses, somewhere you will feel less senses, right? So MRI will have a patchy area of demyelination, we call them Dawson fingers. We call this as Dawson fingers. And in CSF you will find antibodies band. These antibodies bands are called oligoclonal band. Antibodies band, oligoclonal band. तो डायग्नोस करने का क्राइटेरिया होता है, दिस क्लिनिकल क्राइटेरिया इज व्हाट वी कॉल दिस मैकडोनल्ड्स क्राइटेरिया। ये भी क्वेश्चन आ चुका है एग्जाम में। सो मैकडोनल्ड्स क्राइटेरिया इज यूज्ड टू डायग्नोस एमएस। डन। So these are the MCQs which they ask on MS. MS means multiple sclerosis. Am I clear, guys? Okay, now moving to Alzheimer's. So this you can notice these are called neurofibrillary tangles. These are triangular structures which we see in Alzheimer's disease. Neurofibrillary tangles which we see in Alzheimer's disease. So from Alzheimer, understand what type of question they ask you in exam. They ask you simple MCQs. Just I'm writing all the question of Alzheimer. You will see tau protein accumulation. देखो tau protein will accumulate, it will not mutate. तो म्यूटेशन किस प्रोटीन का होता है? सो म्यूटेशन यू विल सी ऑफ 4 प्रोटीन, प्रीसेनिलिन 1, प्रीसेनिलिन 2, amyloid precursor protein and ApoE. So these are the proteins which are mutated. Then understand in this this tau protein what they will form. This tau protein will form neurofibrillary tangles. And diagnosis is again clinical. देखो MRI में what you will get in MRI? In MRI you will find like cortical atrophy, but cortical atrophy normally बूढ़े लोगों में होती है. It is a normal age related change. So diagnosis we make based on clinical symptom, and in treatment the most effective drug will be donepezil. Sometime we can add, if it is not controlled with this, then you can add rivastigmine. So these are the MCQs which they ask on Alzheimer. Done. So these are the MCQ which they ask on Alzheimer. Okay, moving to next topic which is called meningitis. So from meningitis they ask you a lot of question in exam, but basically यहाँ से question आता है आपके CSF findings से. So just look at this Karnik signs and Burzynski signs. These are two signs. And if I talk about symptoms, which patient will have, so you can notice patient को क्या होगा, there will be headache, seizures. So these are the two main symptoms. कभी कभी vomiting भी आती है. So these are the symptoms and sign what we see, where we see in meningitis. Now look at the screen carefully and try to understand. So how we make a diagnosis? Diagnose करने के लिए आपको क्या करना है? Lumbar puncture. Lumbar puncture we can do in lying position or we can do in sitting position. So in lumbar puncture, for this we need needles. So this is the needle that we use for LP needle. इसको और क्या बोलते हैं? We call this LP needle or like Whitaker needle. We call this LP needle or Whitaker needle. So basically आपसे जो क्वेश्चन पूछते हैं, they ask you question on CSF finding. So in CSF they will ask you like, in CSF what are the parameters that we check? So we check CSF glucose. We check for CSF glucose. We check for CSF glucose. Then what else we check? We check for CSF proteins. We check for CSF pressure. We will check for cells. Now understand. इसको समझो एक बार. So what are the three types of meningitis which we need to differentiate? So we need to differentiate bacterial meningitis, bacterial meningitis. Bacterial meningitis is also called as pyogenic meningitis. Then second type is we need to talk about tubercular TB meningitis, and third will be viral. Viral is also called as aseptic. वायरस को और क्या बोलते हैं? एसेप्टिक. अब देखो दिस इज़ वेरी सिंपल टेबल, ये बहुत इजी है. दिस इज़ वेरी इजी. आई डोंट नो वाई स्टूडेंट मेक दिस मिस्टेक. और यहाँ से एक क्वेश्चन एग्जाम में बार बार आता भी. सो दे ऑलवेज आस्क यू अ क्वेश्चन इन एग्जाम. So understand this thing. Bacteria they love glucose. So पहले इसको देखो, इसको सिंपल करते हैं. Protein pressure you will see it will increase in all meningitis. तो मैं सब पे increase ही लगा दे रहा हूँ. Simple. So protein pressure will increase in all. Bacteria love glucose. So what bacteria will do? They will eat all the glucose. तो CSF में glucose कैसा हो जाएगा? कम. So CSF glucose in bacterial meningitis will be less. TB is also bacteria, so it is less. Virus they don't love glucose, so in viral meningitis it will be normal. Virus में कैसा होगा? Normal. Done. तो सबसे पहले first thing in the MCQ what you have to see, सबसे पहले आपको क्या देखना है? Glucose. Now coming to cells, अगर बैक्टीरिया होगा then you will find normally we have 0 to 5 lymphocytes which are normal. तो normally 0 से 5 तक के lymphocyte होते हैं जो normal है. अब cells कौन से बढ़ेंगे? Now understand which cells will increase. You will see cells which will increase here. Which cells? You can notice the cells in bacteria it is neutrophils. So neutrophils will be more. TB, in TB you will see lymphocyte will be more, and in viruses also lymphocyte will be more. So these are like the differences which you have to remember of different meningitis. So ध्यान से देखो क्वेश्चन में सबसे पहले क्या देखना है आपको? What you have to see? You have to see glucose. उसके बाद क्या देखना है? उसके बाद we need to see cells. Very very important. Am I clear? So these are the things which we need to understand. Done? Okay. Now look at the screen. This is like an image based question. इसको बोलते हैं autologous blood patch. So many students they have marked this as like a red CSF. देखो just focus carefully here. Like a doctor is giving this, not it's not. अगर लेता तो ऐसे हाथ होते. It is giving. So what we call this? It is called autologous blood patch. An autologous blood patch we use whenever patient is having recurrent headache. We use this in treatment, like we use in recurrent headache post LP. अगर पेशेंट को बार बार सर में दर्द हो रहा है या ज़्यादा सर में दर्द हो रहा है लंबर पंक्चर करने के बाद, then what we use this blood patch. Then okay, now let's talk about myasthenia gravis. So myasthenia gravis is a disease which is like Amitabh Bachchan is having this disease. So in 1984 he was diagnosed with this. So here we will have three important antibodies which you have to remember. This is called anti-acetylcholine receptor antibody. Second antibody will be anti-MuSK antibody. MuSK means anti-muscle specific kinase. And third antibody which you have to remember, this was last year INICET question, anti-LRP4. Anti-LRP4. So these three are the main antibodies which we find in myasthenia. Now look, whenever we see a patient of myasthenia, जब भी आप myasthenia patient को देखोगे you will see different symptoms. So I can say symptom will be weakness. So weakness पूरी body में होगी. So first symptom that patient will develop will be ptosis. You can see weakness in the facial muscles. So you can see a vertical opening of mouth. So normally लोगों की smile कैसी होती? You will see normal people. What type of smile they will have? So if you see normal people, they will have a horizontal opening of mouth. But if you see a vertical opening of mouth, now see, this is normal opening of mouth. But if you see a vertical opening of mouth, this is something different. This vertical opening of mouth is called snarling face. In meningitis charubala, we will give ceftriaxone. Empirical आपको start करना है ceftriaxone. Normally हम 1 ग्राम BD start करते हैं, यहाँ पर आपको 2 ग्राम देनी है. अगर पेशेंट को ज़्यादा तेज बुखार है, if patient is having severe fever or his TLC is very high, then we start ceftriaxone plus vancomycin. अब suppose आपने start कर दिया ceftriaxone, then we will wait for the culture report. तो जैसे ही culture आएगा, as soon as you will see culture report will come, then what we do? We switch to specific. Suppose culture में आया means ceftriaxone resistant, then we will stop ceftriaxone and clindamycin sensitive, then we start with the specific antibiotic. Then so this is called snarling face. Snarling face means you will see vertical opening of mouth because of facial weakness. So again you can notice here clear cut snarling face. Then this is called ice pack test. तो इस अम्मा को ध्यान से देखो, ये अम्मा पेपर में 4 बार आ चुकी है आपके एग्जाम में। आइस पैक टेस्ट मीन्स वेन एवर यू अप्लाई आइस, देखो यू कैन नोटिस देयर इज टोसिस इन द आइस। व्हेन यू अप्लाई आइस यू कैन नोटिस टोसिस विल इम्प्रूव। सो बर्फ लगाने के बाद टोसिस इंप्रूव हो गए, वी कॉल दिस आइस पैक टेस्ट। इट्स अ बेड साइड टेस्ट टू डायग्नोस मायस्थीनिया ग्रेविस। Then what we can do this test. This test is called tensilon test. Tensilon test, or what we call this hydrophonium challenge test. Hydrophonium challenge test means we will give patient hydrophonium. So एक साथ 10 mg नहीं देते, we will give 2 mg, then 4 mg, then 4 mg, right? In viral, Charubal understand, in viral we will start antiviral. So basically it is due to herpes, then we will start acyclovir. इन टीबी वी विल स्टार्ट एटीटी। टीबी में क्या देंगे, सेम जो टीबी का ट्रीटमेंट होता है, आइसोनियाज़ाइड रिफाम्पिसिन, राइट, इथाम्ब्यूटोल पाइजोनामाइड। तो यू कैन नोटिस हियर टोसिस, एंड आफ्टर गिविंग एड्रोफोनियम टोसिस इम्प्रूव। दिस इज कॉल्ड एड्रोफोनियम चैलेंज टेस्ट, और आई कैन से टेंसिलॉन टेस्ट। नाउ दिस इज लाइक अ डिफरेंशियल डायग्नोसिस ऑफ मायस्थीनिया। जस्ट वन मोर थिंग आई विल ऐड हियर, जस्ट याद रखना, ये क्वेश्चन बार बार पूछते हैं। डीप टेंडन रिफ्लेक्स, डीप टेंडन रिफ्लेक्स मायस्थीनिया में कैसा होता है? सो डीप टेंडन रिफ्लेक्स, दिस विल बी नॉर्मल इन मायस्थीनिया, इट इज नॉर्मल इन मायस्थीनिया ग्रेविस। तो डीप टेंडन रिफ्लेक्स विल बी नॉर्मल इन मायस्थीनिया। दिस इज व्हाट वी कॉल दिस फ्लॉपी बेबी सिंड्रोम, और आई कैन से फ्लॉपी बेबी। सो दिस इज लाइक ड्यू टू कंजप्शन ऑफ हनी। सो हनी अगर खाने से क्या होगा, it will cause like botulism. So this is called infant botulism. So patient will have complete hypotonia, there is loss of muscle tone. This is one of the differential diagnosis of myasthenia, right? Now let's talk about Kampavta or Parkinsonism. This disease was first diagnosed by American scientist, his name was James Parkinson. लेकिन उससे पहले इसका डिस्क्रिप्शन संस्कृत में था एज कंपवता। कंपन मीन्स ट्रेमर। सो इन पार्किंसन अंडरस्टैंड द अर्लीस्ट सिम्टम वी हैव इज एनोस्मिया। एनोस्मिया विल अकर ईयर्स बिफोर ट्रेमर्स। कई महीने पहले क्या होगा, पेशेंट को सूंघना कम हो जाएगा। सो आफ्टर एनोस्मिया यू विल सी पेशेंट विल हैव सम क्लासिकल सिम्टम। सो दिस क्लासिकल सिम्टम you can remember by mnemonic trap. Trap means there will be tremors. Then you can notice rigidity. There is akinesia or bradykinesia and there is postural instability. Akinesia, bradykinesia, postural instability. Now try to understand. So when they ask you question on this this Parkinson, so these are 4 classical symptoms. Out of these, कुछ books में इसको triad लिखा गया, but Harrison says we don't have a triad. We have these 4 classical symptoms, and what we call them? We call them as cardinal symptoms. So these are cardinal symptoms of Parkinson. अगर आप देखो कि like famous Muhammad Ali, famous boxer, he developed Parkinson, right? So you can see, look at the facial expression, ध्यान से देखो, you can see this is like an aggressive facial expression. Same Muhammad Ali now in Parkinson, he is having Parkinson. अब देखो फोटो खिंचा रहे हैं, still he is not smiling. You can see there is loss of facial expression. So this is like expressionless face. ऐसे चेहरे को बोलते हैं typical. You can see her daughter. इसके अगर आप बेटी को देखोगे, like she is smiling. Muhammad Ali is also smiling, but आपको नहीं दिख रहा है. He is smiling, but this is what we call this mask-like face or expressionless face. Mask-like face or expressionless face means there are no expression on face. Mask-like face or expressionless face, right? Okay, then there are certain conditions which look like Parkinson, or I can say they have Parkinson के symptom के अलावा यहाँ पर कोई और symptom भी होते हैं. We call them Parkinson plus syndrome. So this is called MSA. MSA means multi-system atrophy. So in MSA, what you will notice, right? In MSA, what you will notice patient will have hot cross bun sign. We call this hot cross bun sign. Now this is again a disease which will have Parkinson symptom plus some other feature. इसको बोलते हैं PSP और Steele Richardson syndrome, progressive supranuclear palsy. इफ़ यू फोकस केयरफुली, अगर आप ध्यान से यहाँ देखोगे, हियर व्हाट वी कॉल दिस हमिंग बर्ड साइन. We call this as hummingbird sign. So hummingbird sign you will see where in PSP, progressive supranuclear palsy. And this is what we call this like eye of tiger appearance. Eye of tiger appearance, understand? This is something that we see in Halo-Warden-Spart syndrome. Halo-Warden-Spart syndrome. Right, Halo-Warden-Spart syndrome. So we call this eye of tiger appearance. And this is, you can see, अगर आप ध्यान से देखोगे तो पांडा दिख रहा है. We call this panda sign. So this is panda sign. Now see, panda sign I told you in gallium scan also. So gallium scan में panda sign कहाँ मिलता है? Sarcoidosis. बस panda sign in MRI you will see where? In a patient of where? Wilson disease. So Wilson disease patient can also develop secondary Parkinson. Right. So this is about your panda sign. Now coming to this, you can see in Parkinson patient, this is a normal person. Normal person अगर आप देखोगे biopsy में, you can see this black pigment is there. So this is called substantia nigra. But in Parkinson you will see ये pigment गायब हो गया. So this is normal person. So normal, if you do biopsy of you or me, you will find this normal. But in Parkinson you can see this pallor. So what we call this? इसको क्या बोलते हैं? We call this pallor of substantia nigra. Pallor of substantia nigra or depigmentation, and this is something which we see in Parkinson disease. Right? This is something that we see in Parkinson disease. So this is about your Parkinson, which you have to remember. Right? Okay, so let us now solve few questions which came in exam about neurology. So you can notice like few more things. I think the time is up. We have time limit till 6 o'clock. So rest left out part will continue in the next discussion. Right? So this is about the Parkinson part which we have discussed. So I hope you enjoyed this neurology session. एक वीडियो और करेंगे कल. In this we'll discuss the further topics. Thank you so much. Just keep working hard, keep revising. सब कुछ करो, बस टाइमली ये भी करते रहो. And remember the positivity, the spirit of positivity. You can, you will. All the best. Bye bye.